The cold hit Clara like a fist. Not the kind of cold you shake off or complain about over coffee. This was the sort that crawled inside your bones and made a home there. The kind that killed people who weren't careful. She felt it cut through her worn traveling coat the moment she stepped down from the stagecoach, her boots sinking into snow that had been packed down by wheels and horse hooves until it was slick as river ice. Behind her, one of the twins started crying. Then the other joined in. Clara closed her eyes for just a second, just one, and let herself feel the full weight of exhaustion that had been building for 3 weeks. 3 weeks of bad roads, worse company, stale bread, and nights sleeping upright in cramped coaches that smelled like sweat and tobacco. 3 weeks of telling herself it would be worth it when she finally arrived. 3 weeks of lying to herself. She opened her eyes and looked across the street. Red Hollow wasn't much to look at. A main street of packed dirt and snow, flanked by wooden buildings that looked like they'd been thrown together in a hurry and left to weather on their own. A general store. A saloon with a crooked sign. A church with peeling white paint. Everything had that gray, beaten-down look that frontier towns got when they'd been fighting the land too long and losing. And standing in front of the general store, arms crossed over a wool coat that probably cost more than Clara had ever owned in her life, was Gerald Pritchard, the man she'd come 800 miles to marry. He wasn't looking at her yet. He was talking to another man, older, with a thick beard and a sheriff's badge pinned to his chest. They were both watching the stagecoach, but their expressions were casual, unhurried, like they were discussing the weather or the price of grain. Clara's heart was pounding so hard she could feel it in her throat. She shifted one of the twins, Thomas, though she could barely tell them apart when they were both red-faced and screaming, higher on her hip and reached down for her bag. It wasn't heavy. Everything she owned in the world fit into one canvas sack that had seen better days. The stagecoach driver, a grizzled man named Pete, who'd barely spoken 10 words to her the entire journey, was already unloading the freight. He shot her a glance that might have been sympathetic or might have just been tired. Hard to tell. "You need help, miss?" Clara shook her head. "I'm fine." She wasn't fine. She took a breath, squared her shoulders, and started across the street. The snow crunched under her feet. The twins kept crying. Somewhere behind her, a dog was barking. The whole town felt like it was watching, even though when she glanced around, most folks were going about their business. A woman sweeping a porch. A man loading supplies onto a wagon. Normal things, but she could feel it, that weight, that attention. Gerald saw her coming. She watched his face change. Not dramatically, nothing so obvious, just a subtle shift. His jaw tightened. His eyes went flat. The kind of look you'd give a stranger asking for directions, not the woman you'd proposed marriage to through 6 months of letters. Clara stopped 3 feet away from him. Up close, he looked exactly like the photograph he'd sent. Tall, clean-shaven. Handsome in that sharp, angular way some men were. Brown hair slicked back with pomade. Eyes the color of slate. He was probably 40, maybe 45. Successful, by the look of his clothes. The kind of man who didn't do physical labor for a living. "Mr. Pritchard," she said. Her voice came out steadier than she felt. He didn't smile, didn't step forward, didn't offer to take her bag or help with the babies. He just looked at her. Then at the twins. Then back at her. "Miss Hayes," he said finally. The silence that followed was excruciating. The sheriff was still standing there, watching now with open interest. A few other people had slowed down, pretending not to stare, but absolutely staring. Clara felt her stomach drop. She started. "You didn't mention children," Gerald said. His voice was calm, matter-of-fact, like he was pointing out a discrepancy in an invoice. Clara's mouth went dry. "I wrote to you," she said. "In my last letter, I told you about—" "You told me you were widowed," he interrupted. "You said nothing about bringing 2 infants." "I sent the letter 3 weeks before I left," Clara said. The panic was starting to creep into her voice now, and she hated it. "You must not have received it before I—" "Doesn't matter." Gerald uncrossed his arms and straightened up. "I made my intentions clear. I was looking for a wife, a companion, someone to manage my household." He looked at the twins again, and this time there was something close to disgust in his expression. Not a ready-made family. Thomas was still crying. Sarah had gone quiet, but only because she was trying to grab Clara's hair with her tiny fists. "Mr. Pritchard, please, I'm sorry you came all this way," Gerald said, and he didn't sound sorry at all. "But I can't accept this arrangement. It's not what I agreed to." The world seemed to tilt sideways. Clara heard someone laugh, short and mean, from somewhere nearby. The sheriff was frowning now, but he didn't say anything, just watched, waiting to see what would happen. "You sent me money for the journey," Clara said quietly. "You wrote 6 letters. You made promises. And you misrepresented yourself." "I did not." "You did." Gerald's voice was still calm, but there was steel underneath it now. "Whether through intent or incompetence, the result is the same. I will not be held responsible for your choices, Miss Hayes." He turned and started to walk away. Just like that. Clara stood there, frozen, while the man she'd traveled 800 miles to marry walked back into his store and closed the door behind him. The street was quiet except for the wind and the babies. Clara felt something crack open inside her chest. Not her heart, that had broken a long time ago, back when they'd lowered Michael into the ground and told her she'd need to be strong for the children. This was something else. Something deeper. This was the moment when she realized she'd made a terrible mistake. She'd gambled everything on a stranger's word, and she'd lost. "Miss?" She turned. The sheriff was standing beside her now. Up close, he looked older than she'd first thought, 60 maybe. His face was weathered and creased, but his eyes were kind. "You got anywhere to go?" he asked. Clara shook her head. She didn't trust herself to speak. The sheriff sighed, looked up and down the street like he was thinking. Then he nodded toward a building at the far end, 2 stories, with a sign that read Cole's Boarding House in faded letters. "Come on," he said. "Let's get you out of the cold." "What?" The boarding house smelled like lye soap and old wood. Martha Cole was a woman who looked like she'd been carved out of the same hard frontier stone as everything else in Red Hollow. Tall, broad-shouldered, gray hair pulled back in a bun so tight it could probably stop bullets. She took one look at Clara standing in her doorway, shivering, babies crying, sheriff hovering awkwardly behind her, and made a decision in about 3 seconds. "Inside," she said, "before you freeze to death on my porch." The front room was small but warm. A potbelly stove in the corner was putting out enough heat to make Clara's fingers start tingling as the feeling came back into them. There were 2 chairs, a table, and a shelf full of books that looked like they'd been read so many times the spines were practically falling apart. Martha pointed at one of the chairs. "Sit." Clara sat. The sheriff tipped his hat. "I'll leave you to it, Martha." "You do that, Bill." The door closed behind him. Martha crossed her arms and looked down at Clara with an expression that was impossible to read. "So," she said, "you're Pritchard's mail-order bride." Clara flinched. Yes. Was... He turned you away." It wasn't a question. Clara nodded. Martha made a sound somewhere between a snort and a laugh. "That tracks. Gerald Pritchard's a son of a bitch on a good day. On a bad day, he's worse." She looked at the twins, who had finally, mercifully, gone quiet. "How old?" 6 months. "Both of them?" "Twins." "Yeah, I figured." Martha uncrossed her arms. "You got money?" Clara hesitated, then nodded. "A little." "How little?" $3. Martha closed her eyes, opened them. "Christ." "I can work," Clara said quickly. "I'm not asking for charity. I can clean, cook, mend, whatever you need. I just need a few days to figure out..." "Figure out what?" Martha interrupted. "There's nothing to figure out, girl. You're stranded in the middle of nowhere with no money and 2 babies. Winter's coming down hard. You think you're going to walk to the next town? It's 40 miles through country that'll kill you before you make it halfway." Clara felt tears burning behind her eyes. She blinked them back. She'd cried enough already. "I don't know," she admitted. "I don't know what to do." Martha stared at her for a long moment, then she sighed. "You can stay here," she said. "Room and board, but you work for it. I'm not running a charity house. You help with cooking, cleaning, laundry, whatever needs doing, and you keep those babies quiet at night because I've got other boarders and they won't tolerate screaming at all hours." Clara felt something loosen in her chest. "Thank you," she whispered. "Don't thank me yet," Martha said. "You might not last a week." The room Martha gave her was barely bigger than a closet, a narrow bed, a washstand, a single window that looked out over the back alley. The walls were thin enough that Clara could hear the man in the next room coughing, deep and wet, like his lungs were trying to crawl out of his chest. But it was warm, and it was shelter. Clara laid the twins down on the bed. They'd finally fallen asleep, worn out from crying, and sank into the chair by the window. For the first time in weeks, she let herself stop moving. And the second she did, everything came crashing down. She'd left everything behind, sold the house Michael's parents had given them, said goodbye to the few friends she had left, packed up every memory, every piece of her old life, and walked away from it because Gerald Pritchard had made promises. Promises he'd broken the second it became inconvenient. Clara put her head in her hands. She didn't cry. She was too tired to cry. But she sat there, in that tiny room in a town where she knew no one, and let herself feel the full crushing weight of how completely and utterly alone she was. The next 3 days passed in a blur of work. Martha hadn't been kidding about earning her keep. Clara was up before dawn, helping with breakfast for the boarders, 6 men, all of them rough-looking types who worked at the lumber mill on the edge of town. She cooked, cleaned, washed sheets that smelled like sweat and tobacco smoke, hauled water from the pump out back until her arms ached. The twins were a constant background noise, crying when they were hungry, crying when they needed changing, crying for no reason at all, except that they were 6 months old, and that's what babies did. Martha tolerated them, barely. The boarders ignored them. Clara pushed through it all like she was wading through deep water, every movement exhausting, every hour stretching out forever. On the 4th day, everything changed. It started with the man in the room next to hers, the one with the terrible cough. Clara was in the kitchen, elbow deep in dishwater, when she heard the shouting. "Martha! Martha! Get up here!" She dropped the plate she'd been washing and ran. The upstairs hallway was narrow and dark. One of the boarders, a big man named Frank with a scar across his cheek, was standing outside the room, looking pale. "He's bad," Frank said. "Real bad." Martha was already inside. Clara followed. The man, his name was William, she'd learned, was on the bed, gasping for air. His face was gray. His lips were tinged blue. The sound he was making was horrible, like something trapped and dying. Martha was standing beside the bed, hands on her hips, looking grim. "Go get the doctor," she said to Frank. "Doc Hale's out at the Morrison Ranch," Frank said. "Won't be back till tomorrow." Martha swore under her breath. Clara moved forward without thinking. "Let me see him," she said. Martha turned. "What?" "Let me see him." Clara was already at the bedside, looking down at William. His chest was barely moving. His breathing was shallow and rapid. "You a nurse?" Martha asked. "No." Clara put her hand on William's forehead, burning hot. "But my husband was a physician. I helped him for 3 years before he died." That was stretching the truth. Michael had been a country doctor, and Clara had helped in the way most wives did, fetching supplies, keeping records, sometimes holding a patient's hand while Michael worked. But she'd watched, she'd learned, and right now, watching was better than nothing. "He's got pneumonia," Clara said. "Fluid in the lungs. He can't breathe." I can see that," Martha said dryly. Clara looked around the room. "I need clean water, towels, and something to prop him up. Pillows, blankets, whatever you have." Martha hesitated. Then she nodded at Frank. "You heard her? Move." Clara worked through the night. She couldn't cure pneumonia. That would take time and luck, and probably a real doctor. But she could make William more comfortable. She propped him up so the fluid wouldn't pool in his lungs. She kept his fever down with cool compresses. She got him to drink water, just a little at a time, so he wouldn't dehydrate. And she stayed with him. The twins cried in the other room, and Martha dealt with them. The other boarders came and went, shooting curious glances through the doorway, but Clara didn't move. By morning, William was breathing easier. Not well, but easier. Martha appeared in the doorway with a cup of coffee. "You look like hell," she said. Clara took the coffee. "Thanks. He gonna live?" Maybe, if the doctor gets back soon. Martha nodded, looked at William, then at Clara. Where'd you learn that? She asked. I told you, my husband. Yeah, I heard what you said. Martha's eyes were sharp. But watching someone work and actually doing it yourself are two different things. You knew what you were doing in here. Clara didn't answer. The truth was, she wasn't sure she had known. She'd mostly been guessing, working off half-remembered lessons and pure desperation. But it had worked, sort of. The doctor will be here this afternoon, Martha said finally. You should get some rest. I'm fine. You're dead on your feet. Martha jerked her head toward the door. Go. I'll watch him. Clara went. Dr. Lucas Hale arrived just after noon. Clara heard him before she saw him, boots on the stairs, Martha's voice explaining the situation. Then the door to William's room opened and closed. She was in the kitchen trying to get Sarah to eat mashed vegetables without throwing them everywhere when Martha came down. Doctor wants to talk to you, she said. Clara's stomach dropped. Why? How the hell should I know? He just said, get the woman who is taking care of William. Clara wiped her hands on her apron and went upstairs. Dr. Hale was standing beside William's bed, a black leather bag open on the table beside him. He was younger than she'd expected, maybe 35, with dark hair that needed cutting and a face that looked like it had forgotten how to smile somewhere along the way. He looked up when she came in. You Clara Hayes? He asked. Yes. Martha says you're the one who kept this man alive last night. Clara shook her head. Just what? Hale interrupted. He wasn't hostile exactly, but there was something hard in his voice, something that didn't waste time on pleasantries. Just happened to know how to position a pneumonia patient to prevent aspiration? Just happened to know how to manage a fever without overcooling? Clara didn't answer. Hale studied her for a moment. Then he turned back to William, pulling out a stethoscope. Your husband was a doctor, he said. It wasn't a question. Yes. What kind? Country physician? General practice. And you helped him. Sometimes. Hale listened to William's chest, frowning. Then he straightened up and started packing his bag. William's going to pull through, he said. Thanks to you. Another few hours and he'd have been too far gone. Clara felt something unknot in her chest. I'm glad, she said quietly. Hale snapped his bag shut, looked at her again with those sharp, measuring eyes. You have medical training? He asked. No, just what I picked up from my husband. That's more than most people in this town. He paused. I could use an assistant. Clara blinked. What? An assistant, Hale repeated. Someone to help at the clinic. Change dressings, prepare instruments, keep records. Basic work. Nothing complicated. Clara's mind was racing. I have children, twins. Bring them. I don't know if the pay's not much, Hale continued, like she hadn't spoken. But it's steady. And there's a room above the clinic, small but private. Better than staying here. Clara stared at him. This didn't make sense. She'd been in town less than a week. She'd helped one sick man. That didn't qualify her for anything. Why? She asked. Hale's expression didn't change. Because I need help, and you're capable. That's reason enough. He picked up his bag and headed for the door. Then he paused. Think about it, he said. If you're interested, the clinic's on Main Street. Blue door. You can't miss it. And then he was gone. Clara stood there in William's room, listening to the sick man's labored breathing, and tried to process what had just happened. A job. A real job. A way forward. She didn't let herself hope. Not yet. But for the first time since she'd stepped off that stagecoach, she felt like maybe, just maybe, she wasn't completely out of options. She told Martha that evening. They were in the kitchen, Clara washing dishes while Martha counted the day's receipts at the table. Dr. Hale offered me a job, Claire said. Martha looked up. Did he now? As his assistant at the clinic. Huh. Martha went back to counting. You gonna take it? Clara rinsed a plate, set it in the rack. I don't know. Why not? Because I'm not qualified. I don't have training. You kept William alive, Martha interrupted. That's qualification enough in a place like this. Clara turned. You think I should take it? Martha shrugged. I think you need work, and Hale's a good man. Doesn't say much, keeps to himself, but he's fair. Treats everyone the same, whether they can pay or not. She paused. Town doesn't much like him for that. Why not? Because he doesn't play the game, doesn't kiss ass, doesn't care who's important and who isn't, just does his job. Martha looked at Clara with those sharp eyes. You'd be working for a man who makes enemies without trying. You sure you want that kind of trouble? Clara thought about Gerald Pritchard, about the way he'd looked at her twins like they were something distasteful he'd found on his boot. I'm already in trouble, she said. Martha snorted. Fair point. Clara showed up at the clinic the next morning. The blue door was easy to spot, just like Hale had said. The building was small, just one story, wood frame with a hand-painted sign that read Physician in simple black letters. She knocked. No answer. She tried the handle. Unlocked. Inside, the clinic was sparse but clean. A waiting area with 3 chairs, an examination room visible through an open doorway, shelves lined with bottles and jars, everything labeled in neat handwriting. Dr. Hale? She called out. Back here. She followed his voice to the examination room. Hale was bent over a table, stitching up a gash on a young boy's arm. The kid was maybe 10, tears streaming down his face, but trying hard not to make noise. Hold still, Hale said quietly. Almost done. Clara watched him work. His hands were steady, precise. No wasted movement. He tied off the last stitch and straightened up. Keep it clean, he told the boy. Change the bandage every day. Come back in a week so I can check it. The boy nodded and scrambled off the table. Hale turned to Clara. You came, he said. I did. Good. He nodded toward a door at the back. Upstairs is the living quarters. 2 rooms, one's mine, the other's yours if you want it. We can move your things this afternoon. Clara hesitated. I haven't said yes yet. Hale raised an eyebrow. You're here, aren't you? I need to know what you expect, what the job actually involves. I already told you, assisting, cleaning, record keeping. And the pay? $5 a week, plus room and board. It wasn't much, but it was more than she had. What about my children? Clara asked. What about them? They're loud. They cry. They'll disturb your work. Hale shrugged. Then we'll figure it out. Clara studied him. He wasn't charming, wasn't warm, didn't make promises or try to sell her on anything. But he was honest. And right now, that was worth more than charm. All right, she said. I'll take it. Something that might have been a smile flickered across Hale's face. Good, he said. Start tomorrow. Moving took less than an hour. Clara didn't have much to move, just her bag, the twins, and a handful of things she'd accumulated at the boarding house. Martha helped her carry everything over, making sarcastic comments the entire time about how Clara was moving up in the world. The room above the clinic was small, but it had a window that let in real light and a bed that didn't sag in the middle. There was even a small stove in the corner. It felt like a palace. You sure about this? Martha asked as Clara unpacked. No, Clara admitted, but I don't have better options. Martha nodded, looked around the room. Hale's a good man, she said again. But people are going to talk. About what? About a widow living under a single man's roof. Martha's expression was serious. It doesn't matter that it's innocent. It doesn't matter that you're working. People see what they want to see. Clara felt something cold settle in her stomach. Let them talk, she said. But even as she said it, she knew it wasn't that simple. Nothing ever was. The first week was brutal. Not because the work was hard, it was, but Clara had expected that. It was brutal because she was learning everything from scratch while trying to keep 2 6-month-olds alive in a medical clinic. Hale threw her into the deep end immediately. You need to know this, he'd say. handing her a medical text. "Read it tonight." "Watch how I do this," he'd say, showing her how to clean a wound. "Tomorrow, you'll do it yourself." He didn't coddle her, didn't slow down. If she made a mistake, he corrected her once and expected her not to make it again. It should have been overwhelming. Instead, Clara felt something she hadn't felt in months. Useful. The twins were a constant challenge. Sarah would cry during examinations. Thomas would knock over supplies. Patients would come in, see the babies, and ask pointed questions that Clara learned to deflect. But Hale never complained. If anything, he seemed to barely notice the chaos. One afternoon, Clara was in the middle of changing a dressing on a man's leg wound while simultaneously trying to keep Sarah from crawling under the examination table. The patient, a gruff logger named Jim, kept shooting nervous glances at the baby. "She gonna be a problem?" he asked. Before Clara could answer, Hale spoke up from across the room where he was organizing supplies. "You got a problem with babies, Jim?" "No, I just—" "Then stop complaining." Jim shut up. Clara finished the dressing and scooped up Sarah, who immediately grabbed a fistful of her hair. "Thank you," she said quietly to Hale. He didn't look up from his work. "For what?" "For not making this harder than it already is." Hale was quiet for a moment. Then he said, "Everyone's got their burden to carry. Yours just happens to be louder than most." It wasn't sympathy. It wasn't even kindness exactly. But it was acceptance. And that was enough. By the end of the second week, Clara had fallen into a rhythm. Up at dawn, feed the twins, start the stove, clean the clinic before patients arrived. Assist Hale with whatever came through the door. Broken bones, infections, childbirths, everything. The work was endless, but it was also satisfying in a way she hadn't expected. Every patient she helped, every wound she cleaned, every fever she monitored, it all added up to something. She was learning, growing, becoming someone different than the desperate woman who'd stepped off that stagecoach. The town noticed. She'd catch people watching her on the street, whispering. Some of them were curious, some were openly hostile, and some, a few women mostly, looked at her with something that might have been envy. One morning, a woman showed up at the clinic with a sick child. Hale was out on a call, so Clara was alone. "The doctor's not here," Clara told her. "But he should be back within the hour if you want to wait." The woman, young, maybe 25 with tired eyes and a baby on her hip, shook her head. "Can you look at her?" she asked. "Please." Clara hesitated. This was crossing a line. She wasn't a doctor, wasn't qualified, but the child was wheezing, struggling to breathe. "Come in," Clara said. She examined the girl. Croup, probably, from the sound of the cough. She'd seen Michael treat it dozens of times. Steam, humidity. Keep the airways open. Clara set up a tent using blankets and a pot of hot water, creating a makeshift steam room. "Keep her in here," she told the mother. "The steam will help her breathe. If she gets worse, come back immediately, but she should improve within a few hours." The woman looked at Clara with something close to reverence. "Thank you," she whispered. After she left, Clara sat down in one of the waiting room chairs and put her head in her hands. She'd just practiced medicine, without supervision, without training. If something went wrong, it would be on her. When Hale came back an hour later, she told him what had happened. She expected anger, reprimand. Instead, he just nodded. "Croup?" "Yes." "Steam treatment?" "Yes." "Good call." He set down his bag. "Next time I'm out, you're in charge. Can't have patients waiting when there's someone here who knows what they're doing." Clara stared at him. "I don't know what I'm doing." "You knew enough to save that child." Hale looked at her with those sharp eyes. "Stop doubting yourself. It's a waste of time." But doubt wasn't Clara's only problem. The real problem walked through the door 3 days later in the form of Gerald Pritchard. Clara was in the back room, washing instruments, when she heard the bell above the door chime. Then Hale's voice, flat and unwelcoming. "Pritchard." Clara froze. "Dr. Hale." Gerald's voice was smooth, polite. "I need to speak with you about a matter of some delicacy." "Then speak. Privately, if you don't mind." "I do mind. Say what you came to say or leave." There was a pause. Then Gerald said, It's come to my attention that you've hired Clara Hayes as your assistant. That's not a secret. No, but it is inappropriate. Clara set down the instrument she'd been cleaning and moved quietly to the doorway where she could listen without being seen. Inappropriate how? Hale asked. She's a widow, living under your roof, working in close quarters with you. Gerald's tone was reasonable, patient, like he was explaining something obvious to a child. Surely you can see how that looks. I see a woman who needed work and a man who needed help. Everything else is your imagination. It's not just my imagination, Doctor. The town is talking. Let them talk. This reflects poorly on both of you, Chumba, Gerald continued. On her reputation, on yours. I'm simply suggesting that perhaps a more suitable arrangement could be found. Such as? There are families in town who might take her in, put her to work in a capacity more fitting for a woman of her station. You mean as a servant? I mean in a respectable position. Hale was quiet for a long moment. When he spoke again, his voice was cold. Get out of my clinic, Pritchard. I beg your pardon? You heard me. Get out. Dr. Hale, I'm trying to help. You're trying to run a woman out of town because she didn't work out the way you wanted, because she had the nerve to show up with children you didn't ask for. Hale's voice was rising now. You turned her away in the middle of winter with nowhere to go and no way to survive. And now you're here, dressed up in concern and propriety, trying to finish the job. Clara's heart was pounding. That's not what this is about, Gerald said, but there was an edge to his voice now. Then what is it about? Silence. Then Gerald said, very quietly, She's making you look bad, Doctor. And in a town like this, that matters. People remember. Let them remember. I don't care. You should care. Because when people lose faith in their physician, they stop coming. And when they stop coming, you have no practice, no income, no future here. Gerald paused. I'm trying to help you avoid that outcome. By asking me to fire the best assistant I've ever had? No thanks. Clara felt something warm spread through her chest. Best assistant he'd ever had. She'd been here 2 weeks. Gerald must have realized he wasn't getting anywhere because his tone shifted. Very well, he said. But don't say I didn't warn you, Doctor. This town has standards, and they don't take kindly to those who flaunt them. The door opened and closed. Clara waited a moment, then stepped out into the main room. Hale was standing by the window, looking out at the street with an expression she couldn't read. You heard? He asked without turning around. Yes. He's right, you know, about the talk. Clara crossed her arms. Do you want me to leave? No. Then why mention it? Hale finally turned to look at her. Because you should know what you're walking into, he said. This won't get easier. Pritchard's got influence in this town. He'll use it. Let him. Hale studied her for a moment. Then something that might have been respect flickered across his face. All right then, he said. Back to work. Wow. But Gerald Pritchard wasn't done. Over the next week, Clara started noticing things. Patients who used to come regularly stopped showing up. Women who'd been friendly in the street now crossed to the other side. The whispers got louder. And then the rumors started. Clara heard them secondhand from Martha, who heard them from her boarders, the doctor and his woman. Living in sin, setting a bad example. Someone should do something. Clara tried to ignore it, focused on her work, on the twins, on learning everything she could from Hale. But it was hard, especially when she saw the way people looked at her now, not with curiosity, with judgment. One afternoon, she was at the general store buying supplies when she overheard 2 women talking in the next aisle. It's shameful is what it is. Absolutely shameful. And with children there, what kind of example is that setting? Someone needs to talk to the sheriff. This isn't right. Clara set down the flowers she'd been about to purchase and walked out. She made it halfway back to the clinic before the anger really hit. Not at the women. Not even at Gerald, really. At herself. For caring. For letting their words get under her skin. For being weak enough to feel ashamed of something she hadn't even done wrong. By the time she got back to the clinic, she was shaking. Hale took one look at her and frowned. What happened? Nothing. Clara, She told him about the women, the whispers, all of it. When she finished, Hale was quiet for a long time. Then he said, "Do you want to quit?" "No." "Then don't." "It's not that simple. It is exactly that simple." Hale's voice was firm. "You're doing good work here, important work. What they think doesn't change that." "It does if they stop coming to you for treatment." "Then that's on them." Hale looked at her steadily. "I'm not asking you to leave, Clara, but I won't force you to stay if this gets too hard. That's your choice." Clara took a shaky breath. "I'm staying," she said. "Good." But as she went back to work, Clara couldn't shake the feeling that this was only the beginning, that the real fight was still coming, and when it did, she wasn't sure she'd be strong enough to survive it. The real fight was still coming. Clara woke up the next morning in the narrow bed above the clinic, the twins already fussing in their cradle. Through the thin walls, she could hear Hale moving around downstairs, the familiar sounds of him preparing for the day. Water being pumped, the stove door creaking open, the clink of instruments being arranged. She lay there for a moment, staring at the ceiling, and tried to remember what her life had been like before this. Before Red Hollow, before the clinic, before she'd learned that survival meant more than just breathing. It meant fighting for every inch of ground you stood on. It felt like a lifetime ago. Sarah started crying in earnest now, and Thomas joined in immediately because that's what twins did. Clara hauled herself out of bed, her body aching from yesterday's work. She'd spent 6 hours on her feet helping Hale with a steady stream of patients. Her back hurt. Her hands were chapped from constant washing. She had a bruise on her shin from where she'd knocked into the examination table. But she was alive. And she had work. And that was more than she'd had 2 months ago. She fed the twins, changed them, got herself dressed in the same worn dress she'd been wearing for weeks. She needed new clothes, but there wasn't money for that yet. Maybe in a few months. Maybe. Downstairs, Hale had coffee ready. "Morning," he said, not looking up from the medical journal he was reading. "Morning." Clara poured herself coffee and sat at the small table. The silence between them was comfortable now. They'd developed a routine over the past weeks. Quiet mornings, long days, professional distance maintained at all times. It worked. Mostly. "We have a full schedule today," Hale said, finally looking up. "Including a house call to the Hendersons. Their youngest has been sick for a week." "What are the symptoms?" "High fever, cough. Mrs. Henderson thinks it might be pneumonia." Clara nodded, mentally reviewing what she'd learned about pneumonia treatment. "I'll prepare the supplies." "Good." Hale went back to his journal. Then, almost as an afterthought, "You did well yesterday with the Jensen boy." The Jensen boy had come in with a badly infected cut on his hand. Clara had cleaned it, applied a poultice, and bandaged it properly while the child screamed. It had been ugly work, but necessary. "Thank you," Clara said. Hale nodded and kept reading, but Clara felt something warm in her chest anyway. Praise from Hale was rare, which made it more valuable when it came. The morning started busy and got worse. First came old Mrs. Peterson with her rheumatism, complaining about the pain in her joints and looking at Clara with barely concealed suspicion the entire time. Then the Miller twins, not babies like Clara's, but 7-year-old hellions who'd gotten into a fight and both needed stitches. Then a pregnant woman having false labor pains. Then a farmer with a dislocated shoulder. Clara moved through it all, assisting Hale, learning by watching, her hands growing steadier with each procedure. By noon, they were both exhausted. "Take a break," Hale said. "Eat something. Check on the twins." Clara nodded gratefully and headed upstairs. Martha had the twins, as usual. She'd taken to watching them during the busiest hours, and Clara was profoundly grateful. She couldn't afford to pay Martha much, but she did what she could. Mending, cooking, helping with the boarding house when time allowed. "They've been angels," Martha said when Clara came in, which meant they'd probably been terrors and Martha was being kind. "Thank you," Clara said, scooping up Sarah. "I don't know what I'd do without you." "Probably lose your mind." Martha studied her. "You look tired." "I am tired." "You're doing too much, working all day, caring for the babies all night, studying those medical books until all hours." "I have to study. I need to learn." You need to sleep, Martha said firmly. You're going to collapse if you keep this up. Clara knew Martha was right, but sleeping felt like giving up, like wasting time she didn't have. I'll rest when I can, she said. Martha snorted. Stubborn. Takes one to know one. They smiled at each other. It was the closest thing Clara had to friendship in Red Hollow, and it meant more than she could express. She was feeding the twins when she heard shouting from downstairs. Not angry shouting, frightened shouting. Clara handed Sarah to Martha and ran. She burst into the clinic to find chaos. A man was carrying a child, a girl, maybe 5 years old, who was limp and unresponsive. Blood was soaking through a makeshift bandage on her leg. Hale was already moving, clearing the examination table. What happened? He demanded. Wagon accident, the man gasped. He was covered in dust and looked near panic. Wheel came loose, crushed her leg. She passed out about a mile back. Please, you have to help her. Put her on the table. Clara, I need... Clara was already there, handing him scissors to cut away the bandage. What she saw underneath made her stomach turn. The girl's leg was mangled, bone visible through torn flesh, still bleeding, though not arterial. That was good, but the damage was extensive. Hale's face was grim. How long ago did this happen? He asked. Hour, maybe more. I got her here as fast as I could. She's lost a lot of blood. Hale was examining the wound, his hands quick and sure. Clara, I need clean water, bandages, and the chloroform. Clara moved, didn't think, just did what needed doing. She'd seen Michael work on injuries like this, had watched him amputate fingers, toes, once even a hand. But she'd never been the one assisting, never been responsible for keeping the patient stable while the doctor worked. Her hands were shaking as she prepared the chloroform. Steady, Hale said quietly, not looking at her. I need you steady, Clara. She took a breath, forced her hands to stop shaking. I'm ready, she said. What followed was 2 hours of intense, focused work. Hale cleaned the wound, removed debris, checked for shattered bone. Clara managed the anesthesia, kept the girl breathing, monitored her pulse. They worked in near silence, communicating in short phrases and gestures. The father paced into the waiting room, occasionally calling out questions that neither Clara nor Hale had time to answer. Finally, Hale stepped back. That's all I can do, he said. The leg's badly damaged, but I think I can save it. We'll need to watch for infection. Keep her here for a few days. Clara looked at the small pale girl on the table. Still breathing, still alive. They'd done it. Help me move her to the recovery room, Hale said. They got the girl settled in one of the beds upstairs, a small room Hale had set aside for patients who needed overnight care. The father sat beside her, holding her hand, tears streaming down his face. Thank you, he kept saying. Thank you. Thank you. She's not out of danger yet, Hale warned. The next few days will be critical. If infection sets in, I understand. But you gave her a chance. That's more than I had an hour ago. After he left, Clara and Hale stood in the hallway outside the recovery room. Clara felt like her legs might give out. You did well, Hale said. I was terrified. Good. Fear keeps you sharp. It's when you stop being afraid that you make mistakes. Clara looked at him, at this man who'd given her a chance when no one else would, who pushed her and challenged her and made her better. Thank you, she said, for letting me be part of that, for trusting me. Hale met her eyes. You've earned that trust. Something passed between them in that moment. Understanding, respect, maybe something more. Then Hale cleared his throat and looked away. We should check on the other patients, he said. Right, yes. They went back to work. But Clara couldn't shake the feeling that something had shifted between them, something subtle but significant. The girl, her name was Emily, survived the first critical night. Clara checked on her every few hours, monitoring her temperature, changing bandages, making sure the wound wasn't showing signs of infection. By the third day, Emily was awake and asking for water. By the end of the week, she was sitting up and complaining about being bored. She's going to be fine, Hale told the father. The leg will heal. She'll walk again, probably with a limp, but she'll walk. The father broke down crying, grabbed Hale's hand and shook it so hard Clara thought he might break something. But then he turned to Clara. Mrs. Hale, he said, my wife wanted me to thank you especially. She said you were the one who kept Emily breathing while the doctor worked, said if you hadn't been there. He didn't finish, didn't need to. Clara felt her throat tighten. I'm glad I could help, she managed to say. After he left with Emily, walking slowly but walking, Hale turned to Clara. Word's going to spread he said. About what you did, how you helped save that child. Is that bad? Depends who's listening. Hale paused. Some people will see it as proof that you're capable. Others will see it as more evidence that you're overstepping. Clara felt a familiar weight settle on her shoulders. I can't win, can I? She said quietly. If I help, I'm overstepping. If I don't help, I'm useless. Welcome to being a woman in medicine, Hale said dryly. The rules are impossible and the game is rigged. Then why bother playing? Because the alternative is letting them win. Letting them decide who gets to help people and who doesn't based on what's between their legs instead of what's in their head. Clara looked at him in surprise. She'd never heard him talk like this before, so bluntly, so angry. You sound like you've thought about this a lot, she said. Hale's expression darkened. I have. He didn't elaborate, just turned and went back to organizing the medicine cabinet. But Clara wondered what had made him so willing to train a woman when most doctors wouldn't, wondered what had happened in his past to make him this way. She wanted to ask. But the walls were back up, the professional distance re-established, so she let it go. For now. That night, Clara couldn't sleep. The twins were finally quiet, a miracle, and the clinic was dark and still, but her mind wouldn't stop racing. She kept thinking about Emily, about how close they'd come to losing her, about how one wrong move, one moment of hesitation could have cost that child her life. The responsibility of it was crushing. Clara got out of bed, wrapped a shawl around her shoulders, and crept downstairs. She meant to go to the kitchen, maybe make tea, but she saw light coming from the examination room. Hale was there, sitting at his desk, reading by lamplight. Can't sleep? He asked without looking up. No. Join the club. Clara hesitated, then she stepped into the room. Can I ask you something? She said. Depends on the question. Why did you really hire me? The truth this time. Hale finally looked up. His face was shadowed by lamplight, hard to read. I told you, I needed help. That's not the whole truth. Hale was quiet for a long moment. Then he said, my wife was a midwife. Clara felt shock ripple through her. You're married? Was. She died 3 years ago. Hale's voice was flat, emotionless. Childbirth. Complications. The baby died too. I'm so sorry. She was good at what she did. Really good. Helped dozens of women through difficult births. Saved lives that other midwives would have lost. Hale looked down at the book in his hands. But she wasn't a doctor, didn't have training, and when she needed help with her own birth, when things went wrong, the doctor who came, he didn't respect her, didn't listen to her. She knew something was wrong. Tried to tell him. He ignored her, said she was hysterical, that women always panicked during labor. Clara felt cold wash over her. She died because he wouldn't listen, Hale continued. Because he assumed that being a man and having a medical degree made him right, and her being a woman made her wrong, even though she had more experience with childbirth than he'd ever have. Lucas, so when you showed up, and I saw that you had knowledge, that you could help people, I thought. Hale trailed off. I thought maybe I could do for you what no one did for her. Give you the training, the legitimacy, the chance to be taken seriously. Clara didn't know what to say. All this time, she thought Hale had hired her out of practical necessity. Or maybe pity. She'd never imagined there was this much pain behind it. I remind you of her, she said quietly. No, you're nothing like her. Hale looked up. She was gentle, patient. You're all sharp edges and stubbornness. But you have the same gift she had, the same ability to see what needs doing and just do it. And I'll be damned if I let that go to waste because people like Pritchard think women should stay in their place. Clara felt tears burning behind her eyes. Thank you, she whispered, for telling me. Hale nodded, looked back down at his book. Get some sleep, Clara. Tomorrow's going to be long. Clara went back upstairs, but this time, when she lay down, she felt different. She'd been thinking of this job as charity, as Hale doing her a favor, but it wasn't that at all. It was him honoring his wife's memory, trying to change a system that had killed her, using his position and authority to give another woman the opportunities his wife had been denied. And that made what Clara was doing here about more than just survival. It made it matter. The next few weeks passed in a blur of work and learning and constant exhaustion. Clara threw herself into studying. Hale had given her a stack of medical texts, and she read them late into the night, absorbing everything she could about anatomy, pharmacology, surgical techniques. Her hands grew steadier, her diagnoses more accurate, her confidence building with each successful treatment. But the whispers didn't stop. If anything, they got worse. Women would come into the clinic and refuse to let Clara treat them. Men would make comments about propriety. The sheriff got called to the boarding house twice to investigate complaints about inappropriate cohabitation. Both times, Bill had waved it off. They're working, he told the complainers. Nothing inappropriate about that. But Clara could see the strain on his face. The pressure was building, and everyone knew who was behind it. Gerald Pritchard had made it his personal mission to drive Clara out of Red Hollow. He couldn't do it directly. Too many people relied on the clinic now. But he worked behind the scenes, spreading rumors, pressuring the town council, making life difficult in 1,000 small ways. One afternoon, Clara was walking back from a house call when Pritchard stepped out of an alley directly into her path. She stopped short, heart jumping. "Mr. Pritchard," she said coldly. "Mrs. Hale," he smiled. "Or should I call you something else, since your marriage is such a convenient arrangement?" Clara felt heat rise in her face. "My marriage is none of your business." "Oh, but it is, when it's being used to circumvent the town's standards of decency." Pritchard stepped closer. "You think you're clever, marrying the doctor so you can keep living under his roof, keep playing at medicine. But everyone knows the truth. And what truth is that? That you're not really his wife, not in any meaningful way. That this is just another scheme, another manipulation." Pritchard's voice was smooth as oil. "Just like coming here pretending you didn't have children, just like latching onto the first man desperate enough to take you in." Clara's hands clenched into fists. "You don't know anything about me," she said. "I know you're a liar. I know you'll do anything to survive. Use anyone, manipulate any situation." Pritchard leaned in, and eventually people will see through you. They'll realize what you really are. And when they do, not even the doctor will be able to protect you. Clara wanted to hit him, wanted to scream, wanted to tell him exactly what she thought of men who measured a woman's worth by her desperation. But she didn't. Instead, she looked him dead in the eye and said, "I may have been desperate when I arrived, but I'm not desperate anymore. I have work. I have purpose. I have skills that this town needs, and nothing you say or do will change that." She walked past him, head high, refusing to let him see how much his words had shaken her, but they had shaken her. Because part of what he said was true. Her marriage to Hale was convenient. It was an arrangement born of necessity, not love. And she wondered, not for the first time, if that made it less valid somehow, less real. She was still thinking about it that evening when Hale found her in the supply room, organizing bandages. "You've been quiet today," he said. "Just tired." "Clara." She looked up. Hale was watching her with those sharp, assessing eyes. "Pritchard got to you," he said. It wasn't a question. "He said some things. About our marriage. About it being fake. Is that what you think it is? Fake?" Clara didn't know how to answer that. "I don't know what it is," she admitted. "We got married for practical reasons. We maintain separate rooms. We don't." She trailed off, feeling her face heat. "We don't what?" "We don't act like a married couple." Hale was quiet for a moment. Then he said, "What do you want us to be?" Clara's heart started pounding. "I don't know," she said honestly. "I'm still figuring that out." "Well, when you figure it out, let me know." Hale's voice was gentle. "Because whatever this is between us, it's not fake. Maybe it's not traditional. Maybe it doesn't look like other marriages. But it's real, Clara. At least it is to me." He left before she could respond. Clara stood there in the supply room, surrounded by bandages and medicines, and tried to process what had just happened. Whatever this is between us. Did that mean Hale felt something more than professional partnership, more than convenient arrangement? And more importantly, what did Clara feel? She was afraid to examine that question too closely, because she was starting to suspect that what she felt for Lucas Hale was a lot more complicated than gratitude, a lot more dangerous than respect, and a lot more terrifying than anything she'd faced since arriving in Red Hollow. The crisis came in October, a logging accident at the mill. Multiple injuries, men trapped under fallen timber. Hale and Clara worked for 12 hours straight, treating crushed limbs, head injuries, deep lacerations. The clinic became a makeshift hospital, every bed filled, patients overflowing into the waiting room. Clara moved through it all like she was underwater, exhausted beyond measure but unable to stop. There were people who needed help, people who would die if she didn't keep working. She set bones, stitched wounds, administered morphine for pain, made decisions about who could wait and who needed immediate attention. Hale was beside her the whole time, but they barely spoke, just moved in synchronized rhythm, each knowing what the other needed before they asked. By the time the last patient was stabilized, it was well past midnight. Clara and Hale stood in the examination room, both covered in blood, both swaying with exhaustion. "They'll all live," Hale said. "Thanks to you." "Thanks to us," Clara corrected. "No, you saved at least 3 of those men. I watched you. You made the right calls every time." Clara felt tears burning behind her eyes. She was too tired to hold them back. "I was so scared," she whispered. "The whole time. Terrified I'd make a mistake, that someone would die because I didn't know enough." Hale crossed the room, took her face gently in his hands. "You saved them anyway," he said. "That's what courage is. Being terrified and doing it anyway." And then he kissed her. Not like before. Not desperate or uncertain. This was something else. Something that felt inevitable. Clara kissed him back, pouring all her exhaustion and fear and relief into it. When they finally broke apart, both breathing hard, Hale rested his forehead against hers. "I love you," he said quietly. "I know this wasn't supposed to be that kind of marriage. I know we agreed to keep it professional. But I love you, Clara. And I'm tired of pretending I don't." Clara's heart was pounding so hard she thought it might break through her chest. She'd sworn she wouldn't do this, wouldn't let herself feel this again, wouldn't risk the kind of loss that could destroy her. But standing there in Hale's arms, covered in blood and sweat and the evidence of a long day's work, she realized something. She'd already risked it. The moment she'd accepted his proposal, the moment she'd started building a life here, she'd opened herself up to loss. The only question was whether she'd have the courage to embrace what she'd found. "I love you too," she whispered. And just like that, everything changed. The fight came sooner than Clara expected. It started with a woman named Elizabeth Garrett, the wife of one of the town council members. She showed up at the clinic on a Tuesday morning with her daughter, a pale girl of about 14 who looked like she hadn't slept in days. Clara was alone. Hale had ridden out to the Dennison farm before dawn to deliver a baby. "I need to see the doctor," Elizabeth said, not looking at Clara. "He's not here. He should be back by this afternoon." Elizabeth's jaw tightened. "Then we'll wait." "I can help you," Clara offered. "If you tell me what's wrong." "I said we'll wait." The girl swayed on her feet. Clara reached out instinctively to steady her, and that's when she saw it. The way the girl was holding her abdomen, the sheen of sweat on her forehead despite the cold. "She needs to sit down," Clara said firmly. "Now." Elizabeth opened her mouth to argue, but the girl made a small sound of pain and doubled over. Clara caught her before she fell. "Help me get her to the examination room," Clara said. This time, Elizabeth didn't argue. They got the girl onto the table. Clara pushed up the girl's sleeve to check her pulse, racing, and then pressed gently on her abdomen. The girl screamed. "What's wrong with her?" Elizabeth demanded, and there was real fear in her voice now. Clara's mind was racing through everything she'd learned, everything she'd seen Michael do. Abdominal pain, fever, rigid abdomen on palpation. "When did this start?" Clara asked. 2 days ago. She said her stomach hurt. I thought it was her monthly courses. Has she been vomiting? Yes, since yesterday. Clara pressed again, this time on the lower right side of the abdomen. The girl's entire body went rigid. Appendicitis. Had to be. And if Clara was right, the girl didn't have much time. I need to get Dr. Hale, Clara said. You said he won't be back until… I'm going to get him now. Stay with her. Keep her still. Don't let her drink anything. Clara was already moving toward the door. Wait, Elizabeth called out. What's wrong with her? Tell me what's happening. Clara turned back, looked at this woman who'd barely acknowledged her existence for weeks, who'd crossed the street to avoid her, who'd probably called her shameful behind her back. I think it's her appendix, Clara said quietly. If I'm right, she needs surgery, soon, or she'll die. Elizabeth's face went white. Clara didn't wait for a response. She ran. The Dennison farm was 6 miles out. Clara had never ridden a horse in her life, but there wasn't time to think about that. She grabbed the reins of the old mare Hale kept in the shed behind the clinic, hauled herself up with more determination than grace, and kicked the horse into motion. The ride was a blur of cold wind and terror. Clara held on for dear life, her mind cycling through everything that could go wrong. She could be wrong about the diagnosis. The girl could deteriorate before Hale got back. The appendix could rupture. The twins were with Martha. She'd dropped them off that morning when Hale left, knowing she'd need to mind the clinic alone. At least they were safe. She found Hale coming down the road from the Dennison place, his horse moving at an easy trot. Clara? He pulled up short when he saw her. What's wrong? Elizabeth Garrett's daughter. Appendicitis, I think. She's bad. Hale's entire demeanor changed in an instant. He wheeled his horse around. Show me, he said. They rode back together, faster this time. Clara's hands were numb on the reins by the time they reached the clinic. Inside, Elizabeth was standing beside the examination table, holding her daughter's hand. The girl was whimpering, curled on her side. Hale moved immediately to examine her. Clara watched his face as he palpated the abdomen, checked her pulse, looked at her eyes. How long has she been like this? He asked Elizabeth. 2 days of pain, worse since this morning. Hale straightened up, looked at Clara. You were right, he said. It's the appendix, and we need to operate now. Elizabeth made a strangled sound. Here? Can't we take her to… There's nowhere to take her, Hale said bluntly. The nearest hospital is 3 days away. She won't make it that far. The appendix is inflamed. If it ruptures, she'll die of sepsis. But you're just a country doctor. I've done this surgery before. Hale was already moving, pulling out instruments, laying them on a clean cloth. Twice. Both patients survived, but I need to do it now before the appendix bursts. Elizabeth looked at her daughter, back at Hale. Then, unexpectedly, at Clara. You'll help him? She asked. Clara nodded. Then do it, Elizabeth whispered. The next 2 hours were the longest of Clara's life. Hale worked with the focused intensity of a man who knew exactly what was at stake. He walked Clara through every step, handing him instruments, managing the chloroform to keep the girl under, monitoring her breathing and pulse. Clara's hand shook the first time she passed him the scalpel. By the third instrument, they were steady. She watched him cut, watched him navigate through layers of tissue with practiced precision, watched him locate the inflamed appendix, angry and red and close to rupturing, and carefully remove it. Clamp, he said. Clara handed it to him. Suture. She had it ready. They worked in silence except for his instructions. Elizabeth waited outside, too anxious to watch but too terrified to leave. When Hale finally closed the last stitch, Clara felt her knees go weak. She'll make it? She asked quietly. If infection doesn't set in. Hale was washing his hands, his movements methodical. We'll need to watch her closely for the next few days. Clara nodded. She looked down at the girl, pale, unconscious, but breathing steadily. They'd saved her. She and Hale had just saved this girl's life. When they told Elizabeth, the woman broke down completely, grabbed Clara's hands, the same hands she'd refused to shake in the street, and sobbed into them. Thank you, she kept saying. Thank you, thank you, thank you. Clara didn't know what to say, so she just held the woman's hands and let her cry. The The girl, her name was Margaret, stayed at the clinic for 5 days while she recovered. Elizabeth stayed with her, sleeping in a chair beside her daughter's bed. And during those 5 days, something shifted. Elizabeth watched Clara work, watched her change dressings, monitor fever, adjust medications, watched her handle the twins while simultaneously caring for her daughter, watched her move through the clinic with quiet competence. On the 3rd day, while Clara was checking Margaret's incision, Elizabeth spoke. "I was wrong about you," she said. Clara looked up. "I believed what people said," Elizabeth continued, "about you and Dr. Hale, about it being improper. I thought—" She trailed off, shook her head. "It doesn't matter what I thought. I was wrong." Clara didn't know what to say to that. "You saved my daughter's life," Elizabeth said quietly. "You didn't have to ride out and get Dr. Hale. You could have waited, but you didn't. You put yourself at risk to help someone who'd treated you poorly." "I did what anyone would have done," Clara said. "No." Elizabeth's voice was firm. "You did what a good person would do. There's a difference." After Elizabeth left with Margaret, fully recovered and walking on her own, word started to spread. It didn't happen all at once, but Clara noticed things changing. A woman she'd never met stopped her on the street to thank her for helping her neighbor. A farmer brought eggs to the clinic as payment and asked Clara specifically to check his wife's cough. Martha told her that the talk in town had shifted from scandal to grudging respect. Not everyone changed their minds. There were still plenty of people who whispered. Still plenty who thought a woman had no business practicing medicine. But some did, and that was something. Hale noticed it too. "You're building a reputation," he said one evening as they cleaned up after a long day. Clara was scrubbing instruments while he organized supplies. The twins were asleep upstairs. Finally, mercifully quiet. "Is that good or bad?" she asked. "Depends on who you ask." Hale paused. "Pritchard won't like it." "Pritchard doesn't like anything I do." "True." Hale was quiet for a moment. "But be careful. A man like that, when he feels threatened, he gets dangerous." Clara set down the instrument she'd been cleaning. "You think he's threatened by me?" she asked. "I think he's threatened by what you represent, a woman who doesn't need his approval, who's making her own way." Hale looked at her. "Men like Pritchard build their power on control. You existing outside that control makes him look weak." "I'm not trying to threaten anyone. I'm just trying to survive." "I know, but that doesn't matter to him." Clara went back to scrubbing, but Hale's words stayed with her. She thought about them that night as she lay in bed, listening to the twins breathe in their cradle beside her. Thought about Gerald Pritchard and his cold eyes and his smooth voice full of concern that wasn't concern at all. She'd been so focused on just getting through each day that she hadn't stopped to think about the bigger picture, about what would happen if she actually succeeded here, if she built a life, a career, a future. Would that be allowed, or would men like Pritchard find a way to stop her? The answer came 2 weeks later. Clara was at the clinic alone again. Hale was treating a logging injury at the mill when the door opened and Sheriff Bill walked in. He looked uncomfortable. "Morning, Clara," he said. "Sheriff?" Clara set down the inventory list she'd been working on. "What can I help you with?" Bill took off his hat, turned it in his hands. "I need to talk to you about something," he said. "Official business." Clara's stomach dropped. "What kind of official business?" "There's been concerns raised about the propriety of your living situation here." There it was. Clara forced herself to stay calm. Concerns from who? "Does it matter?" "It does to me." Bill sighed. "The town council. They've asked me to look into it." "Look into what exactly?" "I work here. I live above the clinic because it's part of my employment. There's nothing improper about it." "You're an unmarried woman living under the roof of an unmarried man," Bill said gently. "In this town, that matters. I have my own room. I'm never alone with Dr. Hale in any inappropriate way. We maintain strict professional boundaries. I believe you. I do." Bill looked genuinely apologetic. "But the council's getting pressure from some influential folks. They want something done." "Done? What does that mean?" "They want you to find other lodging. Move out of the clinic." Clara felt heat rise in her chest. And go where? I can barely afford to live as it is. Any other arrangement would cost more than I make. I know, I told them that, but what? They don't care? Bill was quiet. Clara took a breath, tried to think. What if Dr. Hale and I were married? She asked. The words came out before she'd really thought them through. Bill blinked. Are you? No, but what if we were? Would that satisfy the council? Well, yes, I suppose it would. Then that's absurd, Clara said, her voice rising. It's perfectly acceptable for me to live here if I'm married to him, but not if I'm working for him. That makes no sense. It's not about sense, Bill said quietly. It's about appearances. Appearances. Clara laughed, but there was no humor in it. I'm trying to build a life here, Sheriff. I'm learning a profession. I'm helping people. But none of that matters because of appearances? Bill put his hat back on. I'm sorry. Clara, I really am. But the council's serious about this. They want you out of the clinic within the month. He left. Clara stood there in the empty clinic, hands shaking with anger. A month. She had a month to find somewhere else to live, somehow afford it on her meager salary, and maintain her job and her children and everything she'd worked so hard to build. It wasn't possible. When Hale came back an hour later, she told him everything. He listened without interrupting. His face remained impassive, but Clara could see the muscle in his jaw tightening. Pritchard's behind this, he said when she finished. You don't know that. Yes, I do. He's on the town council. He's been pushing for this since the day you started working here. Clara sank into one of the chairs. What am I supposed to do? Hale was quiet for a long time. Then he said, We could get married. Clara's head snapped up. What? You said it yourself. If we're married, the council has no grounds for complaint. Hale's voice was matter of fact, like he was discussing a treatment plan. It would solve the problem. You can't be serious. Why not? Because marriage isn't a business arrangement. Why can't it be? Hale looked at her steadily. We work well together. We respect each other. That's more than most marriages have. Clara stared at him. You don't even like me. I didn't say I don't like you. I said we work well together, which is true. Lucas, think about it practically, he interrupted. You need a place to live. I need an assistant. Marriage solves both problems and gets the council off our backs. And what about everything else? Clara felt her face heat. A marriage is supposed to be, we can establish whatever boundaries we want, Hale said calmly. This would be a partnership, a professional arrangement. Nothing more unless we both decide otherwise. Clara's mind was spinning. This was insane. She'd come to Red Hollow to marry a stranger once before, and look how that had turned out. But this was different. She knew Hale, worked with him every day, understood his moods, his habits, his way of thinking. And he was right. They did work well together. I need time to think, she said. You have a month, Hale reminded her. Less, actually. The council will want to see progress. I know. Hale nodded, went back to organizing supplies like he hadn't just proposed marriage as casually as suggesting a change in inventory. Clara watched him work and tried to process what had just happened. Marriage. Again. To a man who saw it as a practical solution to a practical problem. Part of her wanted to be insulted, wanted to demand romance and courtship, and all the things a woman was supposed to want. But another part, the part that had survived Michael's death and the journey west and Gerald Pritchard's rejection and everything since, that part was considering it. Because Hale was right, it would solve the problem. And maybe, in this harsh frontier world where survival was the only thing that really mattered, that was enough. That night, Clara lay awake thinking about Michael, who she'd loved and lost, about the future she'd imagined for herself before everything fell apart, about what marriage meant, what it was supposed to mean, what it could mean, about Lucas Hale, who'd given her a chance when no one else would, who'd defended her, who'd taught her, who'd treated her like an equal even when the whole town said she wasn't, about her twins, sleeping peacefully in their cradle, completely unaware that their mother was making decisions that would shape the rest of their lives. In the morning, she found Hale in the clinic, already working. Yes, she said. He looked up from the medical text he'd been reading. Yes to what? To marriage, to your proposal. Yes. Something flickered across Hale's face. Surprise, maybe. Or relief. You're sure? He asked. No, but I'm doing it anyway. Hale nodded slowly. All right then. We need to establish rules, Clara said quickly. Boundaries. This is a partnership, like you said. Not a real marriage. Agreed. Separate rooms. Of course. And we maintain professional boundaries. No one needs to know the details of our arrangement. Makes sense. Clara took a breath. And if either of us wants to end it, we discuss it like adults. Hale finished. No drama, no recriminations. It all sounded so clinical, so cold. But maybe that was safer. When? Clara asked. The sooner the better, before the council pushes harder. Hale paused. This Saturday? That gives us 4 days to arrange things. Saturday, Clara repeated. 4 days. 4 days until she became Mrs. Lucas Hale. The thought made her dizzy. Are you all right? Hale asked, watching her. I don't know, Clara admitted. Ask me on Sunday. News of the engagement spread through Red Hollow like wildfire. Clara hadn't even told anyone yet. She and Hale had agreed to wait until they'd worked out the details. But somehow, word got out anyway. Martha heard it from one of her boarders and showed up at the clinic that afternoon looking suspicious. Is it true? She demanded. Clara was in the middle of organizing the medicine cabinet. She didn't turn around. Is what true? Don't play stupid with me. Are you marrying Lucas Hale? Clara set down the bottle she'd been holding. Yes, she said quietly. Martha stared at her, then she crossed her arms. Why? Because he asked me. That's not an answer. Clara finally turned to face her. What do you want me to say, Martha? That I'm madly in love? That this is a fairy tale romance? Because it's not. It's practical. It solves problems. And right now, that's what I need. Martha's expression softened slightly. You don't have to do this, she said. You could come back to the boarding house. I'd make room. And how would I afford that? I need this job. And to keep this job, I need to stop being a scandal. Clara felt tears burning behind her eyes and blinked them back. This is the best option I have. The best option or the only option? Does it matter? Martha was quiet for a long moment. Then she sighed. He's a good man, stubborn as hell and about as warm as a January wind, but good. He won't hurt you. I know. Do you love him? Clara thought about that, about Hale's steady presence, his quiet competence, the way he'd given her a chance when no one else would. I respect him, she said finally. I trust him. Maybe that's enough. Martha didn't look convinced, but she didn't argue. The wedding was arranged for Saturday afternoon. No ceremony, no guests. Just Clara, Hale, the minister, and 2 witnesses, Martha and Sheriff Bill. Clara wore the best dress she owned, dark blue cotton that she'd mended so many times the seams were more patched than original fabric. She left her hair down because she didn't have time to pin it up properly. The twins stayed with Martha. The whole thing took less than 10 minutes. Do you, Lucas Hale, take this woman? I do. Do you, Clara Hayes, take this man? Clara looked at Hale. He looked back at her, his expression unreadable. I do, she said. Then by the power vested in me, I now pronounce you husband and wife. The minister closed his book. Hale didn't kiss her, just shook her hand, formal and strange. And just like that, Clara was married again. They walked back to the clinic together in silence. Martha had promised to keep the twins for the night. Give you 2 some time to settle in, she'd said with a meaningful look that made Clara want to crawl under a rock. But there was nothing to settle. Clara went to her room, Hale went to his, and that was that. Clara sat on her bed in the gathering darkness and tried to process what she'd just done. She was married to a man she barely knew, a man who'd proposed for practical reasons and expected nothing from her except continued professional competence. It should have felt wrong. Instead, it just felt empty. There was a knock on her door. Come in, Clara said. Hale opened the door but stayed in the hallway. I just wanted to say... He paused, looked uncomfortable. Thank you for doing this. I know it's not ideal. Neither was starving in the street, Clara said. So I suppose we're even. Hale almost smiled. I suppose we are. Lucas? Yes? Why did you really do this? Propose, I mean. You could have found another assistant. Someone the town wouldn't object to. Hale was quiet for a long moment. You're good at this work, yes, he said finally. Better than you think you are. I didn't want to lose that. And I didn't want to see you pushed out of town by people like Pritchard who think women should know their place. It wasn't a declaration of love, but it was honest. And right now, Clara would take honest over romantic any day. Good night, Lucas, she said. Good night, Clara. He closed the door. Clara lay down on her bed, the same narrow bed she'd been sleeping in for weeks, and stared at the ceiling. She was Mrs. Lucas Hale now. For better or worse. The town's reaction to the marriage was mixed. Some people seemed relieved. Others seemed disappointed that there was no more scandal to gossip about. And a few, mostly women, looked at Clara with something that might have been understanding. Elizabeth Garrett came to the clinic the Monday after the wedding with a basket of food. For you and Dr. Hale, she said. Congratulations. Thank you, Clara said, genuinely touched. Elizabeth hesitated. Then she said quietly, I hope you'll be happy. Clara didn't know how to respond to that, because happiness felt like such a distant, impossible thing, like something other people had, people whose lives hadn't fallen apart, people who married for love instead of survival. But she forced a smile. Thank you, she said again. After Elizabeth left, Clara unpacked the basket. Bread, preserves, a jar of honey, a ham that must have cost more than Clara made in a week. She set it all on the table and felt something crack in her chest. Kindness. That's what this was. Simple, uncomplicated kindness from a woman who'd learned to see past appearances. When Hale came in from his rounds, he saw the food and raised an eyebrow. Elizabeth Garrett, Clara explained. Huh. Hale picked up the jar of honey, examining it. That's, unexpected. People can surprise you, Clara said. Hale set down the honey and looked at her. Yes, he said quietly. They can. That night, after the clinic closed and the twins were fed and sleeping, Clara and Hale sat at the small table in the kitchen area and ate bread with butter and honey. It was the first meal they'd shared as husband and wife. It felt strange, domestic in a way Clara hadn't expected. How's your hand? Hale asked. Clara looked down. She'd burned herself earlier that day while heating water and hadn't said anything about it. It's fine, she said. Let me see. She held out her hand. Hale examined the burn, his touch careful and clinical. You should have told me, he said. It's not serious. Still. He got up and retrieved a tin of salve from the medicine cabinet, applied it gently to her palm. There. That should help. Clara watched him work. Noticed the way his hands moved with practiced precision, the way he focused completely on the task, even something as small as treating a minor burn. Thank you, she said. Hale met her eyes. For a moment, something passed between them. Not romantic, not passionate, but something real. Understanding, maybe. Recognition. Two people who'd both lost things, who'd both been forced to rebuild from nothing, who'd found an unexpected partnership in the ruins. You're welcome, Hale said quietly. He went back to his seat. They finished their meal in silence. And for the first time since Clara had stepped off that stagecoach into the frozen hell of Red Hollow, she felt something that might, just might, have been peace. But peace, Clara was learning, never lasted long in Red Hollow. The first month of marriage passed in a rhythm that felt almost normal. She and Hale worked side by side in the clinic, their partnership settling into something comfortable. They spoke mostly about patients, treatments, supplies that needed ordering. At night, they'd eat dinner together, simple meals, nothing fancy, and then retreat to their separate rooms. It was exactly what they'd agreed to. Professional, practical, safe. And it was driving Clara slowly insane. Not because she wanted more from Hale, not exactly, but because the carefully maintained distance between them felt increasingly artificial. They lived in the same house, worked in the same room, shared meals and conversations, and the small moments that made up daily life. Yet there was always that invisible line between them, that unspoken boundary neither was willing to cross. It made Clara feel like she was constantly holding her breath. The twins were growing. Thomas had started pulling himself up on furniture, determined to walk before he was ready. Sarah had discovered she could scream loud enough to wake the dead and used this power liberally. Between caring for them and working at the clinic and managing the house, Clara barely had time to think, which was probably good, because when she did think, her thoughts went to strange places, like noticing the way Hale's hair fell across his forehead when he was concentrating, or the rare smile that softened his whole face when a patient recovered, or the gentle way he handled the twins when he thought Clara wasn't watching. She'd catch herself staring sometimes, then force herself to look away. This wasn't that kind of marriage, she'd remind herself. This was business, but her heart didn't always listen to logic. The trouble started on a Wednesday in late March. Clara was in the clinic's back room preparing a tincture when she heard raised voices from the front, Gerald Pritchard's voice, and Hale's. She set down the mortar and pestle and moved quietly to the doorway where she could listen. "I'm simply saying that the town council has concerns," Pritchard was saying. His voice had that reasonable tone Clara had learned to distrust. "About the clinic's practices." "What practices?" Hale's voice was cold. "Well, for one thing, allowing your wife to perform medical procedures, treating patients without supervision." "Clara works under my supervision." "Does she?" "Because I've heard reports of her treating patients alone, making diagnoses, even prescribing medicines. She's competent." "She's untrained," Pritchard countered, "and it's only a matter of time before someone gets hurt, before a mistake is made that the town, and you, will be held responsible for." There was a pause. Then Hale said very quietly, "What do you want, Pritchard?" "I want you to stop letting your wife practice medicine. Keep her in the background where she belongs, for everyone's safety." "No. I beg your pardon? I said no." Hale's voice was hard as iron. "Clara is the best assistant I've ever had. She's saved lives. She's earned the trust of half this town. I'm not going to sideline her because you're uncomfortable with a woman who knows her own worth. This isn't about comfort. Yes, it is. It's about control. You can't stand that she didn't need you, that she built something without your permission or your help, that she married me instead of crawling back to beg for your approval." Clara heard Pritchard's sharp intake of breath. "You're making a mistake, doctor," he said, and all the false politeness was gone from his voice now. "The town council has the authority to revoke your license to practice, to shut down this clinic. If you continue to defy—" "Then do it," Hale interrupted. "Shut me down. Revoke my license. But you'll have to explain to every family in this town why they no longer have access to medical care, why their children will die of treatable illnesses because you couldn't tolerate a woman who refused to know her place." Silence. Then the sound of footsteps, the door opening and slamming shut. Clara waited a moment before stepping out. Hale was standing by the window, his back rigid, hands clenched at his sides. "You heard?" he said without turning around. "Most of it." Hale turned. His face was tight with anger. "He's not going to stop." "I know. He'll find a way to come at us, at you, and I can't—" Hale stopped, took a breath. "I won't let him destroy what you've built here." Something warm spread through Clara's chest at those words. What she'd built, not what he'd given her, what she'd built. "What do we do?" she asked. Hale was quiet for a long moment, thinking. "We make you indispensable," he said finally. "We make it so that shutting down this clinic or removing you from it would hurt the town more than it would hurt us." "How?" "By doing what we've been doing, but more of it, better." Hale's eyes were sharp with determination. "We expand our services, reach out to the families and communities that the town council doesn't care about. We build loyalty that Pritchard can't touch." Clara nodded slowly. It made sense, but it also meant more work, more risk, more chances for something to go wrong. "I'm in," she said anyway. Hale looked at her, and something passed between them. Understanding, partnership, maybe even respect. "Then let's get to work," he said. They started with the women. Clara had noticed that many of the wives and mothers in Red Hollow avoided the clinic. They dealt with their health problems privately, quietly, often suffering in silence rather than seeking help. So Clara began making house calls. She'd leave the twins with Martha and walk through town, knocking on doors, introducing herself. Some women slammed the door in her face, but others, slowly, cautiously, let her in. She treated infections, showed them how to manage childhood illnesses, answered questions about pregnancy and childbirth that they'd been too embarrassed to ask a male doctor. Word spread. Within 2 weeks, Clara had a regular circuit of homes she visited. Women started coming to the clinic specifically to see her, asking for Mrs. Hale instead of the doctor. Hale encouraged it. He'd send female patients directly to Clara, trusting her judgment more and more. "You have a gift for this," he told her one evening after a particularly long day, "for making people feel safe. That's rare." Clara didn't know what to say to that, so she just nodded and went back to updating the patient records. But the compliment stayed with her, warmed something inside her chest that had been cold for a long time. The real breakthrough came in April. A young woman named Sarah Brennan, no relation to Clara's daughter, showed up at the clinic late one night. She was maybe 20, pale and shaking, bleeding through her skirt. Hale was out on a call. Clara was alone with the twins, both mercifully asleep upstairs. "Please," Sarah whispered, "I need help, but no one can know I was here." Clara got her inside, got her onto the examination table. Miscarriage, already in progress. Nothing to do but manage the pain and bleeding and make sure she didn't hemorrhage. "How far along were you?" Clara asked gently as she worked. 3 months, maybe 4. Sarah was crying silently. "My husband doesn't know. He's been away working at the logging camp. I was going to surprise him when he got back, but now—" Clara's hands were steady as she cleaned and checked for complications. But her heart ached for this girl. She was so young, so scared. "I'm sorry," Clara said quietly. "I'm so sorry this is happening." "Will I be able to have children again?" Sarah asked. "After this?" "Most likely, yes. There's no reason to think otherwise." "How do you know?" "Because I've seen it before. Women who lose pregnancies and go on to have healthy babies later." Clara met her eyes. "Your body is doing what it needs to do right now. It's not your fault." Sarah broke down completely then. Clara held her while she sobbed, stroking her hair, murmuring comfort. When Hale got back an hour later, Sarah was resting on the examination table, the worst of it over. He took one look at the situation and understood immediately. "I'll make tea," he said simply, and left them alone. Sarah stayed through the night. In the morning, Clara helped her clean up, gave her fresh clothes, and walked her to the door. "Thank you," Sarah whispered, "for not judging, for just helping." "Of course," Clara said. "Can I come back if I need to talk to someone?" "Anytime." Sarah left. And then she told her friends. Suddenly, Clara wasn't just treating coughs and fevers. She was the person women came to with their secret burdens, miscarriages, difficult pregnancies, questions about preventing conception that they couldn't ask anyone else, problems with their monthly courses. All the things that existed in whispers and shame. Clara helped them all. She learned as she went, consulting Hale's medical texts late into the night, asking him questions, building knowledge from every case. And the women protected her in return. When Pritchard tried to spread rumors about impropriety, the women shut it down. When the town council suggested limiting the clinic's hours, families who depended on Clara's help showed up to protest. When someone questioned her competence, there was always someone else ready to testify that she'd saved their wife, their daughter, their sister. Pritchard's power was eroding, slowly but visibly, and he knew it. The confrontation came in May. Clara was walking back from a house call, carrying her medical bag, when Pritchard stepped out of his store directly into her path. "Mrs. Hale?" he said. "A word." Clara stopped. "I'm in a hurry, Mr. Pritchard. This won't take long." He smiled, but there was nothing friendly in it. "I wanted to congratulate you. You've become quite the presence in this town." "Thank you." Quite an accomplishment for a woman who arrived here with nothing, who was rejected and desperate and willing to do anything to survive. Clara's hand tightened on her medical bag. If you have something to say, say it. Pritchard's smile widened. I'm simply observing that you've done well for yourself, marrying the doctor, establishing yourself as some kind of medical practitioner. He said the last words with barely concealed contempt. But I wonder how long it can last. As long as I continue to do good work. Work. Pritchard stepped closer. Is that what you call it? Or is it something else? A woman living in such close quarters with a man, sharing a home, a life. I'm sure the arrangement is quite comfortable. The implication was clear. Clara felt heat rise in her face, not from shame, from anger. My marriage is none of your business, she said coldly. Isn't it? You made it the town's business when you used it to legitimize your position here, when you leveraged it to gain access to homes, to families, to influence. Pritchard's voice was smooth as oil. But I know the truth, Mrs. Hale. I know what you really are. A desperate woman who'll do anything, marry anyone, to avoid facing the consequences of her own poor choices. You don't know anything about me. Don't I? I know you came here expecting me to save you, to provide for you and your children out of the goodness of my heart. When I refused, reasonably, I might add, you latched on to the first man willing to take you in. Pritchard shook his head. That's not strength, Mrs. Hale. That's survival through manipulation, and eventually, people will see it. Clara wanted to hit him, wanted to scream, wanted to tear apart his smug certainty and show him exactly what she'd survived, what she'd overcome, what she'd built from nothing. But she didn't. Instead, she looked him dead in the eye and said very quietly, "You're afraid of me." Pritchard blinked. "Excuse me?" "You're afraid, because I didn't need you, because I found another way. And now every woman in this town who thought she had to accept whatever scraps men like you offered is looking at me and realizing she has options too." Clara stepped closer. "That terrifies you. Because if women don't need you, what power do you have left?" Pritchard's face went red. "You insolent—" "I have work to do," Clara interrupted. "Excuse me." She walked past him, heart pounding, hands shaking. Behind her, she heard him say, "This isn't over." Clara didn't turn around, just kept walking. But she knew he was right. This wasn't over. She told Hale about the encounter that evening. They were in the clinic after hours, Clara organizing supplies while Hale updated patient records. The twins were upstairs with Martha again. It had become their routine. Martha would take the children for a few hours in the evening so Clara and Hale could work without interruption. Hale listened without speaking. When Clara finished, he was quiet for a long moment. Then he said, "He threatened you." "Not directly." "Close enough." Hale set down his pen. "This is escalating." "I know. If he convinces the council to act, then we'll deal with it," Clara said firmly. "We've dealt with everything else." Hale looked at her, really looked at her, and Clara saw something in his expression she hadn't seen before. Worry, maybe, or fear. "I don't want you getting hurt because of me," he said quietly, "because of this arrangement we made. This arrangement saved my life," Clara reminded him. "Whatever happens now, that doesn't change. Still." Hale stood up, walked to the window. "Sometimes I wonder if I did the right thing. Proposing, putting you in this position." Clara felt something twist in her chest. "Do you regret it?" she asked. Hale turned. "No, do you?" Clara thought about that, about the past months, the work, the exhaustion, the constant pressure, but also the growth, the knowledge, the feeling of being useful, needed, capable. "No," she said honestly, "I don't regret it." Something shifted in Hale's expression, softened. "Good," he said quietly. They stood there for a moment looking at each other across the clinic. The space between them felt charged somehow, electric. Then Hale cleared his throat and looked away. "We should finish up," he said. "It's getting late." "Right, yes." Clara went back to organizing supplies, but her mind was spinning. There had been something in that moment, something real, something that felt dangerous and exhilarating all at once. She pushed it away, focused on work, but it lingered, like smoke after a fire. The next morning, everything fell apart. Clara was at the Morrison Ranch, helping with a difficult labor.
The baby was breech, the mother exhausted. Hale was there too. They'd ridden out together before dawn when Mr. Morrison had pounded on the clinic door in a panic. It took 4 hours of careful, painstaking work. Clara held Mrs. Morrison's hand, talked her through the contractions, while Hale maneuvered the baby into position. When the child finally emerged, a girl, healthy and screaming, Clara felt the familiar rush of relief and triumph. They saved her, both of them, mother and child. They were packing up to leave when Mr. Morrison came in from the barn, his face pale. "Doc," he said, "there's a rider from town. Says there's been an accident at the mill. Multiple injuries. They need you back right away." Hale was already moving. "Clara, get the supplies." "I'll stay here," Clara said. "Mrs. Morrison needs monitoring for the next few hours. You go. I'll ride back later." Hale hesitated. "You sure?" "Yes. Go." He went. Clara stayed with Mrs. Morrison, checking her vitals, making sure the bleeding was under control, showing Mr. Morrison how to care for his wife and new daughter. By the time she rode back to town, it was late afternoon. The first thing she noticed was the crowd outside the clinic. The second thing was the smoke. Clara's heart stopped. She kicked her horse into a gallop, racing down the main street. People were shouting, pointing. Someone was trying to organize a bucket brigade. The clinic was on fire. Not the whole building, just the back portion, where the supply room was, where the medicines were stored, where Clara's room was, where the twins— "No," Clara breathed. "No, no, no." She threw herself off the horse before it had fully stopped, pushed through the crowd. Martha was there, holding both babies, both crying but alive. Clara nearly collapsed with relief. "They're fine," Martha said quickly. "I got them out as soon as I smelled smoke. They're fine." Clara grabbed them, held them so tight they protested. She couldn't breathe, couldn't think, could only hold her children and thank every power in the universe that they were alive. "What happened?" she managed to ask. "Don't know. Started in the supply room. Spread fast." Martha's face was grim. "Fire's mostly out now, but the damage—" Clara looked at the clinic. Smoke was still pouring from the back windows. The bucket brigade had the flames under control, but the damage was already done. Hale appeared at her side, soot-streaked and breathing hard. "Clara." He looked at the twins, at her. "Thank God. When I got back and saw— We're fine. The babies are fine. The clinic can be rebuilt," Clara said firmly, even though her voice was shaking. "As long as everyone's safe." But as the smoke cleared and they were able to assess the damage, the full extent of the loss became clear. The supply room was destroyed. Months of carefully organized medicines, instruments, bandages, gone. Clara's room was gutted. The examination room had smoke and water damage. The front waiting area was relatively intact, but the smell of smoke had permeated everything. And in the ashes of the supply room, Sheriff Bill found something. An oil lantern, tipped over in a way that didn't make sense, and a smell that wasn't just smoke. Kerosene. "This wasn't an accident," Bill said quietly. He was standing in the ruins, turning the lantern over in his hands. "Someone did this deliberately." Clara felt cold wash over her. "Who?" she asked. Bill didn't answer, just looked at Hale, and Hale's face went hard as stone. "I want to talk to Pritchard," he said. "Now hold on," Bill started. "We don't know—" "I know." Hale's voice was deadly quiet. "He threatened us. Multiple times. And now my clinic burns down the same day I'm conveniently called out of town? That's not coincidence. You don't have proof. Then get proof." Hale turned to Bill. "You're the sheriff. Do your job." Bill looked uncomfortable. "Lucas, I understand you're upset, but accusing a town council member of arson without evidence— Find the evidence." Bill sighed. "I'll look into it. But in the meantime, you need to secure what's left of this place and figure out where you're going to treat patients until it's repaired." He left. Clara and Hale stood in the ruins of their clinic, the twins quiet in Clara's arms now, exhausted from crying. "We'll rebuild," Clara said, even though she wasn't sure she believed it. Hale didn't respond, just stared at the destruction, his jaw tight. And Clara realized that something had broken in him. Some line had been crossed. This wasn't just about the clinic anymore. This was war.
They spent that night at the boarding house. Martha gave them 2 rooms, one for Clara and the twins, one for Hale. Clara lay awake in the darkness, listening to Thomas and Sarah breathe, and tried not to think about what could have happened. If Martha had been delayed, if she hadn't smelled the smoke in time, if the fire had spread faster, her children could have died. That thought settled into her bones like ice. Someone had tried to burn down the clinic, had set a fire knowing that Claire's children were upstairs, knowing that people could die. All to make a point, to put her in her place, to punish her for refusing to be destroyed. The anger came then, hot and fierce and clarifying. She'd survived her husband's death,
Survived the journey west, survived Gerald Pritchard's rejection and the brutal winter and the constant pressure of building a life from nothing. She wasn't going to let some petty, vindictive man take it all away. In the morning, Clara found Hale in the boarding house kitchen, drinking coffee that looked like it had been sitting on the stove for hours. He looked like he hadn't slept. "We need a plan," Clara said without preamble. Hale looked up. "I have a plan. I'm going to confront Pritchard, make him admit what he did. That won't work. He'll deny it. And without proof, you'll just look like you're making wild accusations." Clara sat down across from him. "We need to be smarter than that." "Then what do you suggest?" Clara had been thinking about this all night. "We rebuild," she said. "Bigger, better. We make the clinic essential to this town, and we make sure everyone knows that if Pritchard tries to shut us down again, he's the one who'll suffer." Hale stared at her. "You want to rebuild?" "Yes." "Clara, we lost everything. The supplies alone will cost. Then we'll raise the money. We'll ask for donations. We'll show the town what Pritchard took from them when he burned down their clinic." Clara leaned forward. "He thinks he can scare us away. We show him he can't." Hale was quiet for a long moment. Then, slowly, a smile spread across his face. Not his usual reserved expression. A real smile. Sharp and fierce and a little bit dangerous. "All right," he said. "Let's do it." They started that afternoon. Hale went door to door talking to every family who'd ever used the clinic, explaining what had happened, what they'd lost, what they needed to rebuild. Clara did the same with the women, the ones she'd helped through difficult births and secret sorrows, the ones who trusted her. The response was immediate. Money came in. Not much from any one person. Most families in Red Hollow didn't have much to spare, but enough. Donations of lumber, nails, labor. Men volunteering to help with reconstruction. Women bringing food, blankets, supplies to replace what had been lost. Within a week, they had enough to start rebuilding, and Pritchard could do nothing but watch. He tried, made speeches to the town council about misplaced sympathy, about rewarding inappropriate behavior, about the dangers of supporting unqualified medical practitioners. But the families who'd been helped by Clara and Hale didn't listen. The tide had turned, and everyone could see it. The new clinic started taking shape in June, bigger than before, better organized, with a separate entrance for women seeking private consultations, with storage that could be locked and secured, with rooms that could be used for overnight patients who needed monitoring. Clara worked alongside the construction crew when she could, the twins playing in a makeshift pen Martha had set up. She'd organize supplies, plan the layout, make lists of what they needed. And at night, she and Hale would sit in the boarding house kitchen and talk about the future, about how they'd run the new clinic, about expanding their services to outlying communities, about training other women to assist with basic medical care. They talked for hours, easily, like partners who'd worked together for years instead of months. And somewhere in those conversations, something shifted between them. Clara would catch Hale looking at her with an expression she couldn't quite read, warm, interested, something more than professional respect, and she'd feel her heart speed up, feel herself blushing for no reason. She tried to ignore it, tried to maintain the boundaries they'd established, but it was getting harder. One night, after a particularly long discussion about treatment protocols, Hale said something that made Clara laugh. Really laugh, not just a polite chuckle. Full and genuine and unguarded. Hale stopped mid-sentence, stared at her. "What?" Clara asked, self-conscious. "I've never heard you laugh like that before," he said quietly. "Oh, Clara felt her face heat.
Sorry, I didn't mean to. Don't apologize. Hale's voice was soft. It's nice, seeing you happy. Their eyes met across the table, and suddenly the kitchen felt very small, very quiet. Clara's heart was pounding. Lucas? She started. But before she could figure out what to say next, Martha burst in with a basket of laundry, and the moment shattered. Don't mind me, Martha said cheerfully, clearly not reading the room. Just passing through. Clara stood up quickly. I should check on the twins. She fled upstairs before Hale could respond. But that night, lying in bed, she couldn't stop thinking about the way he'd looked at her, the warmth in his voice, the almost something that had hung in the air between them. This was supposed to be a practical arrangement, a partnership, nothing more. So why did her chest ache with something that felt dangerously like longing? Clara avoided being alone with Hale for the next 3 days. It wasn't hard. The clinic reconstruction kept them both busy, and with the twins requiring constant attention, there were always interruptions. But Clara knew she was doing it deliberately, creating distance, maintaining the safe boundaries of their arrangement, because that almost moment in the kitchen had terrified her. Not because she didn't want it. That was the problem. She did want it. Wanted to close the space between them. Wanted to stop pretending this was just business. Wanted to see what might happen if they let themselves feel something real. But wanting scared her more than anything else. She'd wanted before. Had loved Michael with her whole heart. And when he died, that love had nearly destroyed her. The grief had been so complete, so crushing, that there were days she couldn't get out of bed. Days when the twins cried and she just stared at the ceiling, unable to move, unable to care. She'd survived it, barely. But she'd learned something from that pain. Love made you vulnerable, made you weak. And in a world like this, weakness got you killed. So Clara worked. Threw herself into planning the new clinic, organizing supplies, treating patients out of a makeshift space Martha had cleared in the boarding house. She kept moving, kept busy, kept her heart locked up tight where it couldn't betray her, and tried not to notice the hurt in Hale's eyes when she made excuses to leave the room. The new clinic opened on a Saturday in early July. It was nothing fancy, just a simple wooden building with a fresh coat of white paint and a hand-carved sign that read Hale Medical Clinic in neat black letters. But to Clara, walking through the door for the first time, it felt like a cathedral. The waiting room was twice the size of the old one. The examination room had proper lighting and ventilation. There was a dedicated space for storing medicines, with locks on every cabinet. And upstairs, 3 rooms, one for Hale, one for Clara and the twins, and one that could serve as overnight patient care if needed. What do you think? Hale asked. He was standing beside her, watching her face as she took it all in. It's perfect, Clara said quietly. It's not perfect. The floor's uneven in the back corner, and the window in your room sticks when it rains. Hale paused. But it's ours. Ours. Not his. Ours. Clara felt something warm spread through her chest. Yes, she said. It is. They spent the rest of the day moving in. The community showed up to help. Families bringing donations of furniture, linens, kitchen supplies. Women Clara had treated brought food. Men who'd helped with the construction stayed to arrange the heavy equipment. By evening, the clinic was functional, ready to receive patients. And Clara stood in her new room, bigger than the old one, with a real bed and a window that looked out over the mountains, and felt something she hadn't felt in years. Hope. Not the desperate, fragile hope of survival, but something stronger, something that looked forward instead of just clinging to today. There was a knock on her door. Come in, Clara called. Hale opened the door but didn't step inside, just stood in the hallway, that careful distance again. I wanted to make sure you had everything you needed, he said. I do, thank you. Good. He started to turn away, then stopped. Clara? Yes? I know things have been strange since the fire, since we started rebuilding. Hale looked at her, really looked at her. If I've done something to make you uncomfortable, you haven't, Clara said quickly. Then why do I feel like you're avoiding me? Clara's throat tightened. She wanted to lie, to brush it off. But something in Hale's expression, vulnerable and uncertain in a way she'd never seen, made her tell the truth. Because I'm scared, she admitted. Hale stepped into the room, not too close, just far enough to be heard clearly. "Of me?" he asked quietly. "No, of myself, of what I might—" Clara stopped, took a breath. This was supposed to be simple, a practical arrangement, but somewhere along the way it stopped feeling simple, and I don't know what to do with that. Hale was quiet for a long moment. Then he said, "What if we stop trying to make it simple?" Clara's heart skipped. "What do you mean?" "I mean, what if we let this be whatever it's becoming, without rules or boundaries or pretending we're just business partners?" Hale took a step closer. "What if we were just honest? Honest about what? About the fact that I care about you, not as an assistant, not as a convenience, as Clara, the woman who rode out in a snowstorm to save a patient, who fought half this town to build something that mattered, who makes me laugh and drives me crazy and makes me want to be better than I am." Clara couldn't breathe. "Lucas, you don't have to say anything," he interrupted. "I'm not asking you to feel the same way. I just needed you to know, because living in the same house and pretending I don't feel anything is killing me." He turned to leave. Clara caught his hand. He stopped, looked back at her, and Clara did something she'd sworn she'd never do again. She let herself be vulnerable. "I'm terrified," she whispered, "of losing someone again, of letting myself care and then watching it all fall apart. I don't know if I can survive that again." Hale's expression softened. He didn't pull away, just stood there, holding her hand. "I can't promise you won't lose me," he said quietly. "I can't promise this will work, or that we won't hurt each other, or that everything will be fine, but I can promise that I'm here now, that I choose to be here, and that I'm not going anywhere unless you tell me to go." Clara felt tears burning behind her eyes. "I don't want you to go," she said. "Then I'll stay." He lifted her hand, pressed a kiss to her knuckles. Gentle, careful, like she was something precious. And Clara felt the walls she'd built around her heart start to crack. They stood there for a moment, just holding hands in the doorway. Not kissing, not making grand declarations, just being honest, being present. It was the most intimate moment Clara had experienced since Michael died. And this time, instead of running from it, she let herself feel it. The next morning, everything was different and exactly the same. They still worked together, still treated patients and managed the clinic and navigated the daily chaos of frontier medicine. But now there were small touches. Hale's hand on her shoulder as he passed, Clara's fingers brushing his when she handed him instruments. Looks that lasted a beat too long. Nothing dramatic, nothing scandalous. Just two people slowly, carefully, letting themselves be more than partners. Martha noticed immediately. "About damn time," she said when Clara came to pick up the twins one afternoon. Clara felt her face heat. "I don't know what you're talking about." "Sure you don't." Martha handed over Sarah, who immediately grabbed Clara's hair. "You and Hale finally stopped pretending you're just colleagues." "We are colleagues. Colleagues don't look at each other the way you two do." Martha's expression softened. "It's good, Clara. Seeing you happy. You deserve that." Clara didn't know what to say, so she just hugged Martha, awkward with a baby between them, and whispered, "Thank you." But happiness, Clara was learning, was always temporary in Red Hollow. The trouble came from an unexpected direction. Not Pritchard this time. The fire had cost him more than he'd anticipated. Several families had stopped doing business with him after word spread about the suspected arson. The town council had started questioning his judgment. He'd lost influence, and everyone knew it. No, this trouble came from the Territory Medical Board. Sheriff Bill delivered the letter personally on a Tuesday morning. Clara was in the clinic, bandaging a child's scraped knee, when Bill walked in. He looked grim. "Is the doc here?" he asked. "In the back. Is something wrong?" Bill didn't answer, just waited until Hale emerged from the supply room. "Letter came for you, Sim," Bill said, handing over an official-looking envelope. "From the Territorial Medical Licensing Board." Hale's face went still as he read. Clara watched the color drain from his cheeks. "What is it?" she asked. Hale looked up. His eyes were hollow. "Someone filed a complaint about the clinic's practices, about me allowing an unlicensed, untrained woman to practice medicine." He looked at the letter again. They're sending an inspector to review our operations and determine if my medical license should be revoked. The room seemed to tilt. When? Clara whispered. 2 weeks. Bill shifted uncomfortably. I'm sorry, Lucas. I know it's Pritchard, Hale said flatly. He couldn't destroy us directly, so he went around us. You don't know it was him. Who else would it be? Bill didn't have an answer for that. After he left, Clara and Hale sat in the empty clinic, the weight of the news settling over them like a shroud. What do we do? Clara asked. Hale was staring at the letter, his jaw tight. I don't know, he admitted. If they revoke my license, I can't practice. The clinic closes. Everything we've built. He trailed off. Maybe I should stop working, Clara said quietly. If I'm not here when the inspector comes? No. Hale's voice was sharp. You're not quitting. You haven't done anything wrong. But if my being here costs you your license, then we'll fight it. Hale looked at her. You're a good medical practitioner, Clara, better than half the doctors I've met. The fact that you don't have formal training doesn't change that. The law doesn't care about that. Then the law is wrong. Clara wanted to believe him, wanted to think they could fight this and win. But she'd seen how these things worked. The system protected itself, protected men like Pritchard and institutions that decided who belonged and who didn't. A woman practicing medicine without formal training, without a license, without a man's explicit permission, that was unforgivable. The next 2 weeks were a special kind of torture. Clara and Hale prepared, organized their records, made lists of successful treatments, gathered testimonials from patients who'd been helped by Clara's care. But underneath it all was the knowledge that it might not matter. The inspector could walk in, take one look at a woman doing medical work, and shut them down on principle. Clara tried to stay calm, tried to focus on the work. But at night, lying in bed with the twins sleeping beside her, she'd stare at the ceiling and imagine losing everything again. The clinic, her home, her purpose. Lucas. That last thought hurt more than she expected. She'd spent so long protecting herself, keeping her heart locked away. But somehow, without her realizing it, Hale had gotten past her defenses, had become essential in a way that terrified her. If they lost the clinic, would they lose each other too? The inspector arrived on a Thursday. His name was Dr. Edmund Porter, and he looked exactly like Clara expected. Late 50s, expensive suit, the kind of man who'd spent his whole life in universities and medical societies and had never treated a patient who couldn't pay in cash. He walked through the clinic with a notebook, writing things down, asking questions in a tone that suggested he'd already made up his mind. Clara stayed in the background. Hale had insisted. Let me handle this, he'd said. The less you're involved in the actual inspection, the better. So Clara watched from the supply room while Porter examined their facilities, watched him frown at the medical texts, watched him ask pointed questions about treatment protocols and patient outcomes, and watched Hale defend their work with quiet, controlled intensity. Your records indicate that your assistant has performed medical procedures independently, Porter said, flipping through the patient log. Diagnoses, prescriptions, even surgical assistance. Under my supervision and training, Hale said, she has no formal medical education. She has 3 years of practical experience and natural aptitude that surpasses many formally trained physicians I've encountered. Porter looked up. That's quite a claim, Dr. Hale. It's the truth. The truth is that medical practice requires formal education and licensing, not natural aptitude, not practical experience. Porter closed the notebook. The regulations exist for a reason, to protect patients from unqualified practitioners. My patients aren't being harmed. They're being helped. That's not for you to judge. Clara felt her hands clench into fists. She wanted to march out there, wanted to defend herself, defend the work she'd done, defend every life she'd helped save. But she stayed silent, because speaking up would only make things worse. Porter spent 3 hours at the clinic, interviewed patients, examined records, made notes that he didn't share. When he finally left, his face was impassive. I'll submit my report to the board within the week, he said. They'll notify you of their decision. And then he was gone. Hale stood in the empty clinic, shoulders rigid, hands clenched. Clara emerged from the supply room. How bad is it? She asked quietly. bad. Hale turned to look at her. He's going to recommend revocation. I could see it in his face. Nothing we said mattered. Clara felt something break inside her chest. Then I'll leave, she said. I'll go before the decision comes down. That way you can claim you terminated my employment. Show them you're complying. Clara, no. This is my fault, Clara said, her voice breaking. I should never have. I knew this would happen eventually. I knew I didn't belong here, that I was playing at something I had no right to. Stop. Hale crossed the room, took her shoulders gently. This is not your fault. You belong here. You've earned your place here. And I'm not letting you leave because some bureaucrat in a fancy suit decided women shouldn't practice medicine. But your license is just a piece of paper, Hale said fiercely. You know what matters? The lives we've saved, the people we've helped, the difference we've made. That's real. That matters. Not some inspector's report. Clara felt tears spill over. I don't want you to lose everything because of me. You're not costing me anything. You're the best thing that's happened to me in years. Hale's hands tightened on her shoulders. I don't care what the board says. I don't care what happens to my license. I care about you, about this work, about what we've built together. Lucas? He kissed her. Not gentle, not careful. Hard and desperate, and full of everything they'd been holding back. Clara froze for half a second. Then she kissed him back, pouring all her fear and anger and love into it. When they finally broke apart, both breathing hard, Hale rested his forehead against hers. I love you, he said quietly. I should have said it weeks ago. I love you, Clara, and I'm not letting this go without a fight. Clara's heart was pounding. She'd sworn she'd never let herself feel this again, never let herself be vulnerable, never risk the kind of loss that could destroy her. But standing there in Hale's arms, she realized something. She'd already risked it, had already let him in, had already fallen so completely that losing him would break her whether she admitted it or not. So she might as well be honest. I love you too, she whispered. And this time, when they kissed, it wasn't desperate. It was something else, something that felt like coming home. The board's decision arrived 5 days later. Claire and Hale were in the clinic when Sheriff Bill brought the letter. They read it together, Claire's hand gripping Hale's arm. The board had decided to suspend Hale's license pending a formal hearing. During the suspension, he was prohibited from practicing medicine. The clinic would be required to close until the matter was resolved. It was over. Everything they'd fought for, everything they'd built, gone. Clara felt numb. We'll appeal, Hale said, but his voice was hollow. We'll fight this. How? They have all the power. We have nothing. We have the truth. The truth doesn't matter, Clara said bitterly. It never has. She walked outside. Needed air. Needed space. She found herself wandering through town, not really seeing where she was going. Just moving. The twins were with Martha again. Clara should go get them. Should figure out what to do next. Should make plans. But she couldn't think past the crushing weight of failure. She ended up at the church, the same church where she and Hale had married. It was empty this time of day, just wooden pews and dusty light filtering through the windows. Clara sat down, stared at nothing, and finally let herself cry. Not quiet tears, not dignified grief. She sobbed like something was being torn out of her chest. All the fear and anger and exhaustion she'd been holding in for months came pouring out. She'd tried so hard, worked so hard, given everything she had, and it still wasn't enough. Clara? She looked up. Elizabeth Garrett was standing in the aisle, concern written all over her face. I heard, Elizabeth said quietly, about the board's decision. I'm so sorry. Clara wiped her eyes. It's fine. I'll figure something out. It's not fine. Elizabeth sat down beside her. It's wrong. What they're doing to you and Dr. Hale. It's wrong. Wrong doesn't matter. They have the authority. They have authority we gave them, Elizabeth interrupted. The people in this town. We're the ones who decide what matters, not some distant board who's never even been here. Clara shook her head. You can't fight the territorial government. Maybe not, but we can show them what they'd be destroying. Elizabeth stood up. Stay here. She left before Clara could respond. 20 minutes later, she came back. With 30 women behind her, Clara stood up, confused. What's going on? We're going to the town council, Elizabeth said, and we're going to make them listen. The women filed into the church. Clara recognized most of them. Women she'd treated, women whose children she'd saved, women who'd trusted her with their secrets and their pain. You've helped all of us, Elizabeth said. You've done things no one else in this town would do. You've saved lives, including my daughters, and we're not going to let them take that away. But the board's decision can be challenged, said another woman, Sarah Brennan, the girl Clara had helped through her miscarriage. If the town council refuses to enforce it, if they petition the board for reconsideration, if they make it clear that this community supports you. Clara felt something stir in her chest, something that might have been hope. You think they'd listen? She asked. I think they don't have a choice, Elizabeth said. Not if we all speak together. The town council met that evening. The meeting room was packed, not just the women, but their husbands, their families, people Clara had treated over the months, people who'd watched her work and seen what she could do. The council looked nervous. Gerald Pritchard was there, sitting in his usual seat, his face carefully neutral. But Clara saw the tension in his shoulders, the way his jaw tightened when he saw the crowd. He knew what was coming. Elizabeth spoke first, told the story of her daughter's appendicitis, how Clara had recognized the problem and gotten help in time, how Margaret would have died without her. Then Sarah Brennan stood, told her story, how Clara had helped her through one of the worst nights of her life with compassion and skill. One by one, women stood, testified, shared what Clara had done for them. And then the men started. Farmers whose wives Clara had helped through difficult births, loggers whose injuries she'd treated, families who'd trusted her with their children. The testimonies went on for over an hour. When they were done, the room was silent. The council members looked at each other, at Pritchard, at the crowd. Finally, the council chairman, an older man named Robert Hayes, stood. It seems clear, he said slowly, that Mrs. Hale has become an essential part of this community's medical care, and that closing the clinic would cause significant harm. Pritchard leaned forward. The territorial board's decision can be appealed, Robert interrupted. We have that right, and I propose that this council formally petition the board to reconsider their decision, to recognize Mrs. Hale's contributions and allow the clinic to remain open during the appeals process. This sets a dangerous precedent, Pritchard said. His voice was tight. Allowing unqualified individuals to practice medicine? She's not unqualified, a voice called out from the crowd. She's trained. She's experienced. She's saved lives. She's a woman, Pritchard snapped, finally losing his composure. A woman with no formal education, no license, no right to what? Elizabeth Garrett stepped forward. To help people? To use her skills to serve this community? To be more than what men like you think she should be? Pritchard's face went red. This is exactly the kind of motion to petition the territorial board, Robert said loudly, cutting him off. All in favor? 4 hands went up, including Robert's. Pritchard's hand stayed down, but he was outvoted. Motion carries, Robert said. We'll draft the petition tonight. The room erupted in applause. Clara felt tears streaming down her face, but this time they weren't tears of grief. Hale appeared beside her, took her hand. You did it, he said quietly. No, Clara said, looking at the crowd of people who'd stood up for her. We did it. The territorial board's response took 3 weeks. 3 weeks of uncertainty. 3 weeks of keeping the clinic closed, treating patients out of makeshift spaces, wondering if everything would still fall apart. But when the letter finally came, it was better than Clara had dared hope. The board had agreed to reconsider. They would allow the clinic to reopen under close supervision. Hale's license would be reinstated on the condition that Clara work only under his direct oversight and that she pursue formal medical education through a correspondence program the board would approve. It wasn't perfect. There were restrictions, requirements, hoops to jump through. But it was a yes, The clinic reopened on a Monday in late August. The waiting room was full by noon. People who'd been waiting for care. People who just wanted to show their support. People who believed that what Clara and Hale were doing mattered. Clara moved through the familiar routine, checking patients, preparing instruments, updating records. But it all felt different now. Lighter. Like she could finally breathe. That evening, after the last patient left, Clara and Hale sat in the waiting room together. "I got the correspondence program materials," Clara said. "From the board. It's 3 years of study." "That's a long time." "It is." Clara paused. "But at the end, I'll have credentials, real ones. No one will be able to say I don't belong." Hale took her hand. "You already belong. But I'm glad you'll have the paper to prove it." They sat in comfortable silence for a moment. Then Clara said, "I've been thinking about something." "What's that?" "Our marriage, the arrangement we made." She turned to look at him. "I don't want it to be an arrangement anymore." Hale's expression softened. "What do you want it to be?" "Real, honest. Not a partnership on paper, but an actual marriage." Clara felt her heart pounding. "If you want that too." "Clara." Hale pulled her closer. "I've wanted that since the day I kissed you, maybe before." "Then let's do it. Let's stop pretending and just be together. Actually together." Hale kissed her, soft and sweet and full of promise. "Yes," he said, "let's do that." The months that followed weren't easy. Clara studied for her correspondence program while working at the clinic and raising the twins. Hale expanded their services, taking on more difficult cases, training Clara as they went. There were still people who disapproved, still whispers about propriety, still moments of doubt. But there was also growth, success, lives saved, knowledge gained, and there was love. Real, messy, imperfect love that grew stronger with every shared meal, every late-night study session, every crisis they navigated together. The twins grew. Thomas took his first steps in the clinic's waiting room. Sarah said her first word, "Mama," while Clara was treating a patient. Gerald Pritchard left Red Hollow the following spring. His business had suffered, his influence gone. He sold his store and moved east, and no one missed him. Clara didn't feel triumph when she heard, just a kind of quiet satisfaction. He'd tried to destroy her, and she'd survived. That was enough. 3 years later, Clara received her official certification from the Territorial Medical Board. She was now a licensed medical practitioner in her own right. The celebration was small, just Hale, the twins, Martha, and a few close friends. But it meant everything. "How does it feel?" Martha asked, raising a glass. "Being official?" Clara looked around the room, at her children, healthy and happy, at the man she loved, at the life she'd built from nothing. "It feels like I've come a long way," she said quietly, "from that woman who stepped off the stagecoach with nowhere to go." "You were always this person," Hale said. "You just needed the chance to prove it." Clara thought about that, about the desperate, broken woman who'd arrived in Red Hollow with $3 and 2 babies, about everything she'd endured, everything she'd overcome. She'd been forged by loss, tested by hardship, and shaped by every fight she'd survived. And somewhere along the way, she'd stopped being the woman who needed saving and become the woman who saved others. That night, after everyone left, Clara stood in the clinic's doorway, looking out at Red Hollow, the town that had rejected her, that had judged her, that had tried to break her, the town that had also given her everything. Hale came up behind her, wrapped his arms around her waist. "What are you thinking?" he asked. Clara leaned back against him, felt safe, loved, home. "I'm thinking about second chances," she said, "about how sometimes the worst moment of your life can lead you to exactly where you need to be. You think you were meant to end up here? No, I think I chose to end up here. I chose to fight, to survive, to build something that mattered." Clara turned in his arms. "And I chose you." Hale kissed her forehead. "Best choice you ever made," Clara laughed. "Second best. The first was deciding not to get back on that stagecoach." They stood there together, watching the sun set over the frontier, the clinic at their backs, and the future stretching out ahead. And Clara realized something profound. She'd come to Red Hollow looking for security, for someone to save her from the harsh reality of survival. But what she'd found was something far more valuable. She'd found herself. Not the woman Michael's death had broken, not the desperate widow begging for scraps, but someone new. Someone forged in fire. Someone who'd learned that strength wasn't about never falling. It was about getting up every time you did. She'd learned that love didn't make you weak. It made you brave enough to risk everything again. She'd learned that belonging wasn't something given by others. It was something you claimed for yourself. And she'd learned that sometimes the greatest act of courage wasn't facing down danger or overcoming impossible odds. Sometimes it was simply refusing to accept the limitations others tried to place on you. The twins would grow up in this clinic, would watch their mother save lives and fight for her place in a world that said women couldn't do what she did every day. They'd learned by example that strength came in many forms, that resilience was built through surviving things you thought would destroy you. That family wasn't always blood. Sometimes it was the people who chose to stand beside you when everyone else walked away. And maybe, years from now, when they faced their own impossible situations, they'd remember their mother. Remember how she'd arrived in Red Hollow with nothing and built everything. Remember that the power to change your life was always yours if you were brave enough to reach for it. Clara Hayes Hale had learned something essential in the frozen frontier town that had tried to break her. She'd learned that survival wasn't enough. You had to fight for more than just existence. You had to fight for purpose, for dignity, for the right to define yourself instead of accepting someone else's definition. And when you did, when you refused to be diminished, when you claimed your space in the world with both hands and didn't let go, that's when you truly became unbreakable. The wind picked up, carrying the scent of pine and snow from the distant mountains. Winter was coming again. But this time, Clara wasn't afraid. She'd survived worse winters than weather could bring, had weathered storms that had nothing to do with snow and everything to do with the brutal reality of being a woman alone in a world built for men. And she'd done more than survive. She'd thrived, built a life, a career, a family, a legacy. She was Dr. Clara Hale now, not because some board had granted her permission, but because she'd earned it through blood and sweat and years of refusing to quit. And Red Hollow, the town that had rejected her, judged her, tried to destroy her, had been forced to recognize what she'd always known. She belonged here, not as someone's charity case, not as an assistant or a convenience, but as an essential part of the community, as a healer, as a force that had changed everything. Hale tightened his arms around her. "I love you," he said quietly. "I love you too." Simple words, but they carried the weight of everything they'd been through. Every fight, every fear, every moment they'd chosen each other when it would have been easier to walk away. Behind them, the clinic stood solid, a monument to perseverance, to the idea that sometimes the best revenge wasn't destruction. It was building something so good, so necessary, so fundamentally right, that it couldn't be denied. And Clara knew, with absolute certainty, that this was just the beginning. There would be more challenges, more people who'd try to put her back in the box they thought she belonged in, more moments when survival felt impossible, but she'd face them all, because she'd learned the most important lesson the frontier could teach. You didn't wait for permission to become who you were meant to be, you just became it. And let the world adjust. The sun finally slipped below the horizon, painting the sky in shades of gold and crimson. A new night, a new beginning. And Clara Hale, who'd arrived in Red Hollow as nothing and become everything, stood in the doorway of her clinic with the man she loved and the life she'd built, and knew one thing for certain. She was exactly where she was supposed to be. Not because fate had put her there, but because she'd fought her way there, one impossible day at a time, refusing to accept anything less than the future she deserved. And that made all the difference.